Welcome everyone to the Shade Tree Cardiology podcast. This is the inaugural episode with Miss Marie. I am very excited to have her on. I want to give her just a proper introduction and tell you guys why I asked her to be the first person. So she is an advocate for people that have walked the path of addiction. She has walked it herself. She is actually would you call it a moderator or a leader in a group for Sublocade? Is that correct?
Yes, I have a personal Sublocade group on Facebook where I try to help people that are interested in getting off of medicated assisted treatment or that just want some more education and knowledge about different pathways that they can use for recovery.
And that's a huge deal to me and why I wanted to have her on, because, a lot of people donate money to causes and we equate money with something important. Put your money where your mouth is, but she gives her time. I know exactly how much money I have. I have no idea how much time I have. So if I donate my time to something, it's important to me. And it's a big deal to me that she donates her time. So what I would love to do today is take you guys on a walk down memory lane. She has agreed to share her story with us. And in the context of this, I want you guys to think about the patients that you've treated for addiction. Maybe they were in the throes of addiction. Maybe they're having a psychotic episode. Perhaps they were withdrawing, or you know what? Maybe they were seeking medication because they were in a bind and they didn't want to go into withdrawals. Whatever the case was, very often in EMS and emergency medicine at large, we have this tendency to dehumanize these people. We do not look at them as if they are full functioning members of society, as Marie and I were talking about earlier. So I want you to hear from a real person who walked the road and put it all back together. And I want you to understand that she is no more valuable now than she was then, and she was no less valuable then than she is now. She's a human being. She has feelings. All these people have feelings, and I want us to really put more of our effort into humanizing these people. And I want to explain to Marie in context the reason that it's a problem. It's not because we're full of bad people in our field. We we develop the ability to disconnect from a situation because our emotions would be so strong that if we involve them, it would not benefit the patient. So just in context, a person who goes into cardiac arrest, that is not a person to me. That's a math problem, because if I involve my emotions, if I stop thinking about lactic acidosis and correcting hydrogen ions, and I start thinking about, boy, I've got to bring this mother back so she can take care of her children, I'm going to lose sight. I'm going to take my eye off the ball. I'm going to make a mistake, right? Or I'm going to
I can
forget
see
something.
that.
So we need to learn how it's the same with babies, especially babies that have met a terrible end because they were abused, right? We have to be able to disconnect from that situation. So we need to maintain it in that situation, but we don't need to use it as a matter of convenience when we deal with people who are going through a situation so painful that we don't want to envision ourselves in that situation. And that's where the lack of empathy comes from. The weird thing about humans, right? We only have sympathy or empathy for someone if we can see it happening to us. That's the only time we feel like our heart goes out to people. And I want to sort of sponsor a movement or an idea or a thought, whatever you call it, to get people to stop thinking about this the way that they're thinking about it and understand that it could happen to you. It's probably happened to someone you work with and they don't talk about it because of the culture. And just put some more empathy back into medicine, because that is why everyone started it. At some point, we all sit across, a group of people from a table at a table, and we say, they say, why do you want to do this? And we say, I want to help people.
Right.
Well, if you want to help people, you give of yourself. And that's what I hope this podcast sort of engenders in people. So tell us about you, Miss Marie. I'm going to shut up for a minute.
So my name is Marie, and I started sharing my journey here on TikTok actually a few years ago. I was just sitting in my car. I wasn't coming on TikTok to talk about my addiction, to be honest with you. I was just here, just, I didn't know what I was doing, to be honest with you. But one day I was sitting in my car. I was on medicated assisted treatment. For those of you who might not know what that is, I was on Suboxone. It was a medication that helped me during my recovery from my substance use disorder. And I was having a hard time getting that medication from the pharmacy. And I made a video, and that video kind of went viral. And with that came so many people asking me about my recovery that I said, wow, Like, I want to start sharing about my recovery. I want to be more vocal about it. At that point, I was just a mom of 4 kids that was unvocal about her recovery.
Wow. Is that when I hit that thing, is that sound effect coming through on your side?
Yes.
Crap. Okay. I was trying to mute it so my background noise wouldn't get there.
Wait, no, I think you're okay. I think you're okay.
Okay. All right. I just didn't want it to, I didn't want it to overwhelm your audio. That's why I was hitting
No,
the mute.
no, no, you're good.
So
So,
it goes viral. And you know, I had kind of a similar story, so I want to hear how you walk through it. So it goes viral. What's going through your head?
so the video goes viral, and I'm thinking, wow, like people are asking me about Suboxone. Some people were coming at me because I was on Suboxone. So, and some people were like, well, that's not really recovery. You're not in recovery. And then I got to this point where I said, you know what? No, I am in recovery. And I'm going to tell these people that this medication works. This is the reason why I'm able to be a mother today.
Right. And for the people that I'm going to jump in the medical side if it's okay. For the people that don't understand how these opiate medications work to get rid of an opiate addiction, you know, we saturate receptors in the brain with these medications, just like we saturate receptors with other medications. And the idea is that this binds extremely strongly to that receptor, so strongly, in fact, that it will not let the feel good opiates get to that receptor, even if you take them. So it's a way of sort of coding that receptor and not letting your body have feel good receptors so that your brain is able to train itself to go through daily life every day without having that artificial euphoria upon which many people become dependent. And that's a very important concept I want to outline before we go all the way through Marie's story. Is when people become functional addicts, as most people do, this is not like they just party all the time. That's not how this works. It's to maintain levity, so to be able to function. And while we sort of have this mental picture of people who are living on the street and doing this and that, not every story ends there, and most of them spend very little time there. In fact, they spend years functionally addicted to these things, and that's what it takes to get through the day. And they work jobs, they do everything that everyone else does, so it's not like they're going around high as a kite all the time at all. And that's one of the things that makes it so difficult to stop, is when you are physiologically dependent upon something. When you take it away, it's not just a few days of withdrawal or you know, a reset of receptors. It can take years, in fact, to return brain chemistry to something that resembles normal. So you lose the ability to be happy. You go into a very deep sadness that is just soul crushing. And that's one of the biggest reasons people relapse. It's not because they miss getting high. It's not that at all. And I want people to shift away from this idea that all drugs are party drugs. It's one of the biggest myths around Narcan is that an addict wakes up mad because you ruined their high. That's not it at all. They wake up angry because they're afraid. They're
Right.
terrified. Receptors that have
It's
been
happened to
asleep for
me
10
quite a few
years.
times.
Can you tell us more about your story then? Yeah, I want to get into the nuts and
So,
bolts.
so really, my story started like 10, 11 years old. I started really realizing that my parents were always super strict. I grew up in a very traditional Italian family where, like, my dad is the head of the household. I have 2 older brothers and 1 younger brother. My 2 older brothers, one is 15 years older than me, one is 10 years older than me. And then I have a brother that's 2 years younger than me. So there was a big gap in my family. So my parents pretty much had more time with the first 2 children. Like, that's where their focus was. So when it came to my brother and myself, we were pretty much, I felt like we did a lot of things on our own. And my parents were super strict. Any little thing I did, I was always punished, grounded, punished. And it was always like very like large punishments, like you're punished for 3 months for doing that.
Oh, wow.
When it would be like not like I really didn't do anything to deserve like that kind of punishment.
Right.
Very so I would start sneaking out of my house I would take my little brother with me, and I would bring him along, and we would sneak out of the house, and we would go meet up with like the other neighborhood kids that were hanging out. You know, we started drinking, started smoking weed, started smoking cigarettes, just little things. But
Hmm.
now looking back, I realized I was doing this to numb something within myself
Right.
I couldn't figure out why I needed to numb something, but I needed to numb something.
That makes sense, and that's one of the big things I like to push for, and I would love to explore that more with you. Is the underlying cause of why you began to seek an escape, right? And people seek escapes in all forms. Usually, it's just
That's
what your friends are into is what you fall into.
And it was at such a young age that I
Hmm.
wanted to escape. So it's like, why at such a young age? Looking back now, I really truly believe that I had untreated ADHD
Hmm.
and that no one ever realized and saw my struggles in school
Right.
and saw my struggles feeling like I never fit in with people. I would go to a crowd of people and feel like I was always the oddball. I was always the socially awkward girl.
Hmm. You had to
And
always
that's
be the one to earn your place in that group, and it was 5 minutes at the time, and
And that's what I was trying to numb. And like when I started putting substances in my body, I realized I was starting to become more friendly and more outgoing
mhm.
and, you know, the life of the party.
Right. You feel that
Right.
constant social pressure to be able to mimic what everyone else seems to do naturally. You don't think like them. You know that you're different on the inside.
I always knew I was different. I always felt different. So I was always, punished a lot. So I was always learning to do manipulative things, which
Mhm.
was sneaking out, lying,
Mhm.
cheating, stealing, like just always going against the grain.
Right. Well, when the system offers no reward, when it offers only punishment, opposition to that system is natural, even if you're a child, right? I had a similar experience growing up. There was a lot of there was consequences, there was never rewards. So I had to learn how to navigate within that system in a way that I could stand to exist in it. It sounds like you had something very similar. Do you think it's
Yes,
accurate?
it was very similar. So I never really felt like I had like a real connection with my parents per
Hmm.
se. Like I do. I love my parents. They did the best that they could do with me,
Right.
with the cards that were dealt to them. But at the same time, I felt like there was something lacking within that relationship.
Hmm.
Like I felt unseen a lot of the times, unseen and unheard.
I get that, and I think a lot of children go through that, and I want to hijack it for just a minute because it's been shown time and again that in the especially in the emergency medicine realm, if you had to pick one thing that everyone had in common, it's almost always childhood trauma. So it's
Right.
almost always they grew up tough, they grew up hard, whether there was physical abuse or mental abuse or neglect, verbal abuse, whatever the case is. And it is this common thread that binds us because it contributes to our behaviors being so similar. It contributes to our ability to manage chaos because we know we're just intimately familiar with a chaotic environment. We understand all too well the mentality of damned if you do and damned if you don't, right?
Like I thrive off of chaos. I say that all the time
Yeah, I have to
because
have it. Yeah.
right, chaos is how I move. Like I'm so used to it that when things are quiet, it's very awkward for me.
Yeah.
Quietness is something that my body isn't used to.
Yeah. When everything's going well, I get headaches. Yeah.
Right.
I
It
have like cortisol responses to everything being okay. My stuff is so backwards. Which is
That's
a
how
good
I
point.
feel.
CPTSD and ADHD, the symptoms can mimic each other, and we haven't fully defined uh, what the difference is if one predisposes you to the other or if they're totally separate. And I've got a theory that the untreated ADHD child um, is more prone to worse symptoms of that trauma and the aftermath of it because we have a low dopamine level in our brain anyway, so we need intense and challenging experiences to feel the happiness that other people do anyway. And when you find yourself in one of these environments where it's sit down, shut up, don't make waves, go with the flow, or the consequences are extremely severe, I think you find ways to create the chaos that you need with your sort of primitive child brain, and you're just taking a stab at it, but ultimately it makes our situation worse. And it sounds like that might be where you found yourself. So you're I guess preteen at this point, and
Right. And I'm hanging out with the wrong crowd of people. And I started dating young. Even though my parents were strict, I don't know how I was able to manipulate them, to be honest with you, to be able to do some of the things that I did and
Mhm.
got away with.
Oh wow.
So, as strict as they were, I started dating this guy, my high school sweetheart, at the age of 13.
Mm.
Young. I
Yep.
did everything young. Everything that I ever did was young. So I started dating him. We got into a serious relationship at the age of 13. But I stayed with him from the age of 13 to the age of 25.
Oh
So
wow.
I was with him all through high school and past. So we started partying together. He he was the type of guy that was always the life of the party. He had the acid, he had the LSD, he had the we used to do uppers, downers. I don't know what I could really say.
It's going on YouTube, so you can go for it. I mean,
Okay.
this is an honest
Um
conversation. Yep.
right, we used to do all kinds of party drugs together. You name it. We used to do ecstasy. We really got into ecstasy because in the 2000s, like that was like a big thing.
Yeah, it was. Yeah.
THC, ecstasy. We used to go to raves, clubs, parties. It was all fun and games at one point.
Mhm.
It was all fun and games until it wasn't fun and games anymore.
So how did that come about? When do looking back, right? Hindsight's 2020.
So I partied my whole high school years from a young age. I was always the girl that was drinking. When we would go to parties and I would go to the liquor store because I would just pay someone outside the liquor store. Hey, here's $60, 20 for you. Run in and grab me what I need,
Mhm.
and I always had a way to get what I needed. I would do the same thing with cigarettes at a young age. I would pay someone, they were like $3 for a pack of Marlboros back in the day.
Yeah, I remember.
You could just, I would pay someone to run into Wawa and buy them for me, and they would come out. But like those days were all fun while they were happening. It was all fun and games. But I was the girl that instead of like drinking a beer at a party, I was drinking out the bottle.
Right,
Like
right.
like I was the girl that would take so many ecstasy pills. And we used to do weird things with like the ecstasy pills. I could remember having like these little things that would like zap you.
Mhm.
So it would like make you feel good
Right,
to like zap yourself while you were on the ecstasy.
right, right.
It would give you like this whole body feeling.
Mhm.
And when I was doing that, that was probably one of the best feelings I've ever had in my whole entire life. I can't lie.
Right,
It was like this whole body, like inner vibration.
right.
And something in my brain was telling me more, more. It feels good.
Right, because we
There got
adapt,
to,
right? Our brains have sensory adaptation, so that's why there's that classic story of you're chasing the first high, which is really
right.
overly simplified. But these are supra physiologic levels of chemicals inside of a brain that doesn't make enough to begin with, and this is where that propensity for addiction comes from in people who've been traumatized or in people who have ADHD, because when the experience itself of consciousness is actually painful, right? When it's not enjoyable to just be alive, it's difficult to wake up happy because you woke up, because you don't have the brain chemistry other people have. And then all of a sudden, someone gives you something or you find something that can make you feel like $1 million. Oh man, and it sounds like what you're describing is what I'm talking about, this honeymoon phase of substance abuse or use, whatever you want to call it. So at what point do you think it began to occur to you that I'm spending more time altered than not?
So my boyfriend and I, he got to a really bad car accident. He was 21 years old on his third DUI
Oh no.
at the age of 21. So he was in a lot of trouble. He got into, he was on trouble on top of trouble. But the point where he had his accident, we were already playing around with Oxycontin. We were already dibble dabbling with Oxycontin, and we realized that we really loved that medication.
Mm-hmm.
That was the medication that really made me feel whole. It took the broken Marie and it made her feel so good from head to toe. It was that euphoria.
So is this during the time where it's very easy to get, or was it
Yes,
not popular
yes.
yet?
So
Okay.
this was in the early 2000s when it was extremely easy to get Oxycontin. He was seeing a doctor, I was seeing a different doctor, we were seeing multiple doctors.
Mm-hmm.
It got to the point where I was a very responsible person throughout my early teens. I held one job throughout my teens. I worked at a doctor's office. I did like office manager work. It got to the point where I was calling my boss and being like, I can't come to work today. I'm sick. I don't feel good.
Oh man. And this is because of the after effect, or because you're not able to get a hold of the substances? Like where's your
So
head
a
at when
little
this
bit
is
of both.
happening?
There would be nights where I would be doing a lot of ecstasy and then still doing ecstasy and cocaine throughout the night, the morning, the day. And
Mm,
I'd be like, you know what? Screw work today. I'm not going. I'm going to stay in this hotel room and party.
right.
Or
Okay.
there would be a day where I couldn't get my prescription because I already ate it in 2 days. And I'm waiting for my dealer to re-up and I can't get out of bed to go to work today.
So now you've hit a point where you're aware that you cannot function without this substance. Like you,
Absolutely.
okay.
There was a point where I realized if I don't have A, B, C, and D, a little cocktail that I liked, I wasn't going to be able to do anything. I couldn't wake up and go to work. I couldn't wake up and put myself together and get dressed. My bills were not a priority to me anymore. My car that I worked hard for, I was starting to like not pay my car payment on time, not
Mm.
care. I would take my money that was supposed to be for my rent to go get pills instead of pay my rent.
Oh wow.
Right.
So that is sort of jumping a bit into the 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 down the bad time, as they say in Goodfellas, right? So you how are you funding this? Or no, that's not what I want to ask. What I want to ask is, how mentally are you approaching funding this lifestyle? So you've kind of alluded to it. You're not making your car payments, but what you're kind of telling us is this has begun to take a higher priority in life than everything else. And this is where I like to dive deep in these because I don't think people talk about it enough. Can you tell us a little bit about your mental state and how you justify this to yourself? Because that's one of the problems with addiction is we can talk ourselves into anything and we can make it make sense. Right.
Oh, absolutely.
So can you tell me I don't want to put words in your mouth. Can you tell me a little bit about how you feel doing this and how you're justifying it to yourself? Are you starting with, you know what, I'm different than other people. I'm a high performer as long as I have it. My life's built on this. What are you telling yourself?
So at the time, I was working my job at the doctor's office. All through high school, I was at this doctor's office. I was making really good money at the time. So I was telling myself, you're successful. You make a lot of money compared to other people your age, Marie.
Right.
You have a brand new car. You have all the things that your peers want. You still got it together on the outside, even though you're falling apart on the inside, girl. You still have the appearance that you got it all together. And I would tell myself, as long as I hold that appearance up, I'm going to keep doing what I need to do because I knew how sick I was mentally, physically, and emotionally.
Right. So you
So I got another
understand.
job. So
Mhm.
I got another job waitressing at nighttime. So I would go to the doctor's office and work, and then at nighttime I would waitress. The waitressing money was cash money.
Right.
So my first job would pay my bills. The other job would start to pay for my partying habit. But it got
Okay.
to the point where I really had to work 24/7 because I needed to leave with a certain amount of money from that waitressing job to be able to pay for not only my drugs, but my boyfriend's drugs half the time.
So now that's what I was wanting to ask. So now we're entering that functional stage where you are working harder to be able to support this. And in your mind, it's totally justified. You're functional, you're a high performer. You maybe at this point in your career, you're able to do things other people can't do. You're able to make things
Right.
happen. And do you ever start attributing some of your success to the substances and maybe get afraid that you wouldn't be able to have that success without them?
Absolutely, because when I started utilizing the substances, I started to feel like they gave me more energy.
Right.
Even though they were opiates, there was this automatic, like, oh my God, I could overachieve at work. I'm getting all that billing done
That
today
euphoria.
because
Yeah.
I was working faster and more efficiently at first. At first.
Right. So and we need to take a quick break because I got a technical thing I'll have to fix. This is going to shut off in just a second. But do you think that, because this was some of my experience, do you think that in the performance of a mundane task that maybe you didn't enjoy very much, that the opiates were able to inject an artificial level of happiness that could make you more content in your situation, in your life?
Oh, 1,000%.
Okay. And that did that help you become more detail oriented where you caught mistakes you might have otherwise missed? And the reason I'm outlining this is I want people to understand sort of these intricate details of addiction. This is not all party. It's not, oh, I got to be high to get through the day. There are advantages to this. Advantages so much so that people can find themselves locked into a life, a career, a level of performance where they cannot achieve it without them, right? But it's like you said, it's a temporary
Right.
window. Do
And
you feel like you were there?
at first, like, I wasn't looking to go to work all jacked up. I was doing it because it was making me, I would clean more.
Right.
I was cleaning the desk, and like everything was organized and perfect. It's almost like it helped my ADHD.
Yes, yes. And which is true to a large extent, right? Because why do we give ADHD medicines? We try to increase the dopamine and serotonin in the brain. Opiates also do this. Is it the best mechanism for a long, healthy life? No. But is it the most enjoyable? By far. By far, it is the most enjoyable way to do it because these substances induce euphoria. You know,
Yeah.
I don't want to sing the praises of opiates per se. We're going to get into the bad time, but
Oh boy.
I want people to understand that it's not this simple window where they say, oh, you make a choice every time you put it in your body. It's not that simple. It's like a pack of cookies. You know what I mean? Yeah, you make a choice every time you eat an Oreo, but you don't really realize your diet's gotten out of whack until you've gained 10 pounds. And now you've got a habit to break, a lifestyle to break. And with substances, with opiates, especially if you work a high pressure job, which is why we see so much of this in Wall Street, right? If you work a high pressure job, you begin to understand that human beings are not supposed to do what I'm doing. They are not supposed to perform at this level or put up with this stress or do these things. This is my superhuman drug, right? And a lot of us will begin to tell ourselves, you know what? I'm just going to do it until I get XYZ. I'm going to do this until I hit a certain level. I'm going to start looking for another job, da 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 da, right? Did you ever tell yourself any of these things?
Oh, I told myself that all the time. I'm just going to do it until tomorrow. It would always be tomorrow,
Yeah,
tomorrow. And then tomorrow would come and I would be so physically ill that I would say tomorrow again because I needed to satisfy that
hmm,
that chase, that illness, that physical dependence had me wrapped up. It had
yep,
me caught up.
yep.
It had me in a place where I felt like I was getting suffocated and I had no choice.
Absolutely. And I want to say this last thing, and then we're going to pause. Of course, the people who watch the podcast won't perceive it as a pause, but you and I will know because we're in the real world. I want to draw the line, the connection between I'll stop tomorrow and I'll start my diet tomorrow. So for anyone who's never been addicted, so they can understand that these are identical human brain processes. It's just that one's so much more powerful. So you were at the point where you're functional, you're a high performer, and you're fitting in, things are going well. And how do you feel this sort of juxtaposes with how you grew up and how you're dealing with that, and maybe do you feel that this is contributing to you making something out of yourself, helping you fit into that paradigm that was so hard to fit into as a child with strict parents? Like, just in your own words, tell me more about that.
So I really personally think that my parents did the best that they could with the cards that were dealt to them. But growing up in a very strict Italian household, and my parents were born in 1945. So their generation was very strict. Everything was very black and white. Like, you sit at the dinner table, you eat what was given to you, you finish your food. There's no ands, ifs, and buts about it. Like, you just don't ask for certain things. Like, when you go to a store, you don't ask for nothing because you know you're not allowed to.
Did we grow up together? That's this
We could
is
have. We could be siblings. I
I'm
mean,
telling you, yeah.
but like, that's the difference between how I grew up and my children. Like, I'm trying to break cycles. I'm
Right.
working very hard right now because I do see it as being almost a generational curse, generational trauma.
I agree. I think there is a cultural thing because I don't see this in other cultures that I've been exposed to around the world, like in other countries. So for example, there's no Gen X in the Iraqi people that I, lived with and worked with. I think that in the aftermath of the sort of boomer generation, and I don't use the word boomer like as the pejorative that a lot of people do. I just mean the baby boomers, the people born in that. I think there was a very sort of difficult upbringing for them. But I also think that it was one of those systems that if you capitulated to it, there was prosperity on the other end. You could work 40 hours a week. You could have a house and one and a half cars. You could have the American dream working 40 hours a week with no degree. And the cost of living wasn't what it is now. And then I think that that sort of contributed to the friction between us, and I say us because I think you and I are pretty close to the same age. I think I'm a little older than you, but the
Probably
friction
not.
there. Okay, well, the friction
I'm
there.
44, so
Okay, all right, I'll be 40 this year, so we're close.
I'm older than you.
Just barely, just barely. And you know what? You look younger than me though, so you got that going
Well,
for you.
thank you.
It's the years have been kind to me. It was the weekends that did all the damage, I think.
You ain't kidding. I'm trying to reverse it now.
Yeah, I'm doing all I can. We could talk more about that later in here if you want. There's some
Absolutely.
great anti-aging stuff. But anyway, the friction I think came about was because when children, especially the ones with untreated ADHD or some of the CPTSD that you see in people who were physically abused, they called it spankings, but there's a huge difference. When you get into that, we aren't getting back out of the system what we were told we would get if we did what we were supposed to do. And we begin to notice this at 8 or 9 or 10 years old. We begin to notice the abundance of consequence with the lack of reward, right? and
Right.
and we begin to see these things where my parents, for example, I love them, but they were basically part of the generation, the maybe one of the last generations that was programmed: have kids early, get married early. So my parents were essentially children raising children. And I'm not angry with them for that. They did the best they could with what they had. This was how they were programmed. They were told it would all work out just fine, right? And you want to trust the people who raise you the way that they trusted the people who raised them. But I think that the economic boot began to tighten on their throat, and they had to work harder, and they had to be more stressed than any generation previously to them, and that makes the kids take the back burner, so they don't get the attention and things that they need. And in my particular case, dad was always angry, you know and I think that leaves a mark. What were you going to say? I'm sorry.
I was going to say, I could relate to what you're saying so much because that's what happened. My parents were starting to have financial problems where my dad needed to work harder, and where my mom couldn't be a housewife anymore. She needed to work.
Right.
So it became this thing where I almost had some freedom. And
Hmm.
that's where, like, the manipulation and, like, oh, they got to work. So I could do that now. Like, you're right. You're
Hmm.
absolutely right on the money with that.
And I think it manifests in two basic different ways. And I think that's where our paths diverge. And I want to illustrate them so that all the viewers can hear it, the listeners. In your particular case, you were able to pull out a little more freedom maybe when you were younger, right? And I got a little bit of it here and there. I was in a pretty staunchly controlled Pentecostal household. So were your parents Catholic by any chance?
Yes, my
Yeah,
parents were Catholic. We went to church on Sundays. I had to do CCD.
right,
I had to make all my sacraments. But now looking back, I feel like that was all very forced upon me. It
right.
was never what I never like. Now I don't practice the Catholic religion.
Right. So that's why I asked, because you're from up north. You said your parents were Italian. That's a strong
Right.
chance that. So I'm from down south and we're white. We were Pentecostal, right? So, some numbers fit, right? So while the religions are different, the discipline structure is incredibly similar. And I, kind of felt like this most of my life. And this is relevant to addiction because what do you do when you move out? And all of a sudden there's no rules, right? What do? You go
Well, for me,
crazy. Yeah.
Well, for me, this is looking back. Now I realize I moved out at 18. When I moved out, I didn't have the right coping mechanisms, the proper coping mechanisms for me to be successful in life were never taught to me. They were never, ever taught to me. So I went out into the world not knowing how to really cope. And I started coping with things utilizing medication,
Mhm.
utilizing substances, putting things into my body that made me feel good.
Right. And I think that happened to a lot of our parents too. I think it was probably well hidden. But I think the older generation went for alcohol a little more. But that was as taboo as some of the things are to our generation. And I didn't get taught the coping mechanisms, but looking back as I see our generation change and how like economics profoundly impacts that. I think the economics so profoundly impacted my parents, our parents, that they didn't have those coping mechanisms. They didn't know what to do. And maybe that's why they were
Right.
so angry and they were so miserable, because things hadn't worked out the way it was supposed to. And I think that leads to a lot of the stuff down your emotion behavior, because it was like, when you're at work and everybody's suffering the same thing, you don't want to hear somebody complain about it because we're all going through the same thing, right? I think they felt that way. And that's why there was a lot of stuff down your emotion rhetoric, because they didn't know how to deal with it. And everybody was suffering and everybody was going through it. And I think that, I don't think it's their responsibility to figure out a new way to deal with a new problem. But I also think that sort of behavior and rhetoric leads to a lot of propensity for addiction, because when it comes to stuffing down your emotions, and even psychiatry does this now, nobody cares how you feel, they care how you act, right? That's why we have drugs like antipsychotics and things like that. So when you find a drug that makes you feel good and makes you act better, right? Oxycontin, I think, is what you were talking about earlier. It seems like the right tool for the job. And then when you get it from your doctor, hey, of course it's the right tool for the job. I didn't buy this in a
Right.
back alley from a bad
And
guy.
then I started adding benzodiazepines to that. So that combination right there became my perfect get up and go.
So tell me, because the people that are going to listen to this, they're going to understand that we'll combine an opiate and a benzo to put a breathing tube in someone, or perhaps to put a shoulder back in place. So when we think of this combination, we think of it as a turn the brain completely off. Can you please talk about your subjective experience with this, how it made you feel, how you utilized it to feel better so that they can gain an intimate understanding of this pathway?
Right. So for me, the benzos and the opiates together gave me the best euphoric feeling. Like when people talk about like their cocktail of choice, that was my cocktail of choice. That was what I would get up and want to, I needed so many of this and so many of that. But for me, the benzos really took over the opiates. I got really addicted to the benzos. I didn't want to feel my feelings.
Right.
I really was trying to shut my feelings off. I was taking sometimes 20, 30 Xanax bars at like, I've overdosed on Xanax before.
Okay. When you overdosed, did you have to have emergency treatment, like the administration of flumazenil and things like that?
So when I overdosed, to be honest with you, the only thing I remember was waking up in the hospital. One time I woke up with a breathing tube down my throat,
Oh, wow.
and I had no idea how I got into the hospital. I woke up, I had a breathing tube down my throat that was breathing for me. And the nurse was like, "Oh my God, you woke up." And I'm like, "Where am I? How did I
Mhm.
get here?" I had to write it on like a clipboard.
Right, right.
I was so scared. There was no one there. I had no idea. Like, did I get into a car accident? What happened?
Wow.
I was there for 3 days and had no recollection of how I got there. Nothing.
And for anyone listening who doesn't understand, so benzodiazepines are actually something we will use for breathing tubes because they induce amnesia. And we use them for the everything's okay effect, right? Because I can give you enough of a benzodiazepine called midazolam that I can put a tube in your throat and you'll sit there like everything's okay and you'll write on a marker board. You know what I mean? You're scared, but you can handle it versus, most of us gag when we brush our teeth,
Right.
so
I don't know.
benzodiazepines are
This was
utilized for
sick.
that.
It scared me. I
Yeah.
I woke up panicked, but guess what the worst part of this story is?
What's that?
When I woke up, the first thought was, "Oh my God, Marie, you got to get the hell out of here. You're in withdrawal. You
Oh no.
have to get out of this hospital." I was in full blown withdrawal.
Wow.
My skin was crawling. I needed what I needed, and I needed the tube taken out of my throat. I made them take the tube out of my throat so I could get out of the hospital AMA.
And I don't know if anyone's ever walked you through that, but that's a legitimate physiologic response because when we get ready to take people off of the vent, we start tapering down the benzos to see if they'll wake up. So that's amazing. And then for the people who don't understand what we said earlier, flumazenil is the Narcan for benzos. You can think of it that way for the people that aren't medically inclined. But I do want to talk about this a little bit. Benzo withdrawal is much, much, much more dangerous than opiate withdrawal in terms of its risk to life and seizures
Right.
and things. So what was your benzodiazepine of choice? And let's explore, what kind of danger you were in there.
So my benzo story is pretty crazy.
Go for it,
I
man.
I started to get addicted. My doctor was giving me 2 milligram Xanax bars three
Right.
times a day
Good stuff. Yeah.
with the Oxycontin, with fentanyl Doralgesic patches, with the fentanyl lollipops. They
Wow.
were 1,200 micrograms of fentanyl.
That's a
And I
lot.
would cut this stick off the lollipop and I would put 2 lollipops in my mouth, one inside this cheek, one inside this cheek.
Wow.
They were fentanyl. With the fentanyl patch, I would take that off, I would chew it. I would put it in my mouth, I would suck the gel out so that I
Mhm.
could get like an instant hit of it.
Right.
I was taking the bars multiple times a day. The bars started to take over. Like I needed them more than I needed that opiate on my
Right.
receptor.
Right.
So it got to the point where I was going through 90 Xanax bars in 3 days. Like easy. Just
Wow.
blowing through the bottle, blowing through the bottle. I was buying them on the street. Um, it got to the point where my Xanax addiction really took over. I was I was diagnosed with epilepsy because the doctors, I was having so many seizures because of benzo withdrawal that they thought that I was truly epileptic
Wow, man. That's a
to the
huge
point
complication of benzodiazepine withdrawal that we don't really see in opiates very often.
where they medically took my driver's license from me in the emergency room.
For seizure activity.
Right.
Wow. Wow. Now, how
You
long
know
would you
how
say you
hard it
maintain
is?
this?
It's so hard to get your driver's license back once you lose it for a medical reason.
I can believe that. So you have to, what is it, 6 months or so you have to go without having a
No,
seizure or
it it was for me, it was they wanted me to be seizure free for 2 years.
mm,
2 years seizure free. And they wanted proof from a neurologist. It had to be signed off from a doctor. But my benzo addiction took me to some very, very dark places. I started stealing. I didn't give a shit who I stole from because I literally had to have a certain amount of benzos a day to get up. And like, I liked that feeling of nodding out. I liked
Right.
it.
A lot of people
It,
do. Yeah.
it became like a feeling that I was chasing. And as my life became more difficult throughout my addiction, and get to the part where I became a mother, that's when things get a little worse for me.
Can you tell us about that?
Yes. So I had this I had this thing where I went to the hospital because I guess I was withdrawing from benzos. I literally was peeing myself. I lost track of time. I couldn't tell what was real from what was not real.
Oh,
I
wow.
was in a complete psychosis. My children's father, I was dating him at the time. We had no kids. He brings me to the hospital. He comes back from a work trip. I had my medication in a safe. It got to the point where I was sitting at the safe, just spinning the safe because I couldn't remember the safe combination.
So you're under like anesthesia level at this point, or is this a complete
I'm
psychotic break?
I'm in a complete, I don't even know. Literally, he asked me, which was weird because I'm in this, I kept talking about fish. I seen fish swimming. I kept saying, hold your breath because I felt like we were getting bombed. Like somebody put like an attack on the United States. And
Okay.
I thought there was like gas in the air that we couldn't breathe. It was crazy.
So you're living a nightmare at this point. You're having like a
Yes.
dream state emergency.
Right. He
Okay.
asked me to make him a bowl of cereal. I got up, I put the cereal in the bowl, and I went to the sink and I filled it up with water and I handed it to him. And that's when he said, something ain't right with you. Like
Yeah.
he, but what he did was he took me, he ripped my clothes off, he threw me in an ice cold shower.
Oh, wow. So he's thinking he
That's
needs to sober you up, I guess.
right. He's
Okay.
thinking, oh my God, what is going on with this girl? Like she's pissing herself. I don't know what's going on. She's talking stupid. She's not making any sense. I'm going to throw her in an ice cold shower, thinking that he was going to sober me up. I
Right.
literally think that made me worse.
Oh, yeah. Yeah. No, no, I can see that. I can see that. Yeah.
By the time I got to the hospital, I was telling them, like, hold your breath. Like, come on, they're gassing us. Like, they put me in a room with a babysitter. They took a spinal tap because they thought I had meningitis.
Because of the psychosis. Okay.
Right. I was not making no sense. My body was shaking so bad because I think I was in benzo withdrawal. I
Right.
couldn't really tell what was real from what wasn't real. I don't remember the last time that I used. I don't know what I even took.
That sounds like withdrawal, actually. Yeah, because you get this rush of adrenaline and there's a lot going
Right.
on.
And
Yeah.
I'm go and I remember I just needed to get into the safe because that's where my meds were and I couldn't get the code. The
Oh, wow.
code that I used multiple times a day to get into the safe. I couldn't
Now,
remember.
were you making a conscious effort to try and stop, or had something happened that made you forget to take your medicine that day, or
I
did it come
don't
out of
remember.
nowhere? Okay. All
I
right.
have no idea. I know I was just in a very dark place. I was by myself. I was alone, home alone. I just think maybe I was just in a hey, I'm gonna party phase.
Oh, wow. Okay.
And it backfired. And I believe if my kid's father didn't come home when he came home, he might have walked into something different
Right.
because I
Right.
was in such a bad place. I don't know. By the time I got to the hospital, my potassium was completely depleted.
Wow.
Um, I was in the hospital and my primary care doctor at the time, who was giving me medication, she was prescribing me benzos. She was prescribing me methadone at the time. She was prescribing me fentanyl patches at the time. She was like, we're going to put you on like a medical detox in here. We are going to administer the doses and take it out of your hands. And it took me about a month to like really come to.
Wow.
I was very scared that I was never going to be myself again.
Oh, my goodness, man.
I kept asking the doctor, and she knew me really well. am I ever going to be back to Marie again? The Marie that I know? Like, am I going to keep peeing myself? Am I going to have track of time again? Like, because I noticed that I had no track of time. Like, I like the president of the United States, I was getting that stuff wrong.
Oh, wow,
And I was
man.
scared that I was like, I was scared that I finally burnt myself out.
Oh no. I'm so
It was
sorry.
scary. I was in there, and when I was in there, they started managing my meds and trying to get me back on track. And slowly, I started to come back to myself. At that time, my doctor wanted me to sign myself into a program. I wasn't
Right.
ready.
Right.
I wasn't ready. I'm like, I'm not doing that. Like, I'm
Right.
still, Marie's not done doing what Marie wants to do.
Right. Right. Well, and none of us want to acknowledge that we've lost control. The minute we get a grip on something again, we want to take that control. Um,
Right.
you
And I
know,
can remember being in the hospital, and like, it got to the point where, like, even like they were giving me the fentanyl patches, I was poking holes in them, sucking
right.
the stuff out of it, trying, having my kid's father bring me up medication from home and taking it, starting to do it how Marie wanted to do it again.
Right. Right.
And I finally got to the point where they discharged me from the medical side of the hospital, and they put me in the psych unit part. And I was in there for about 30 days. So I was in the hospital for about 2 months at this point.
What was your experience like in the psychiatric ward in terms of the care that you received and how you felt about it, how you took to it? Because I think it's an important part of recovery that you believe in the process.
Well, this is the thing. I have a lot of trauma when it comes to psychiatrists and psychiatric hospitalizations. Throughout my addiction, I've probably had about 25 different psychiatric hospitalizations.
Mhm.
I've been in and out of psychiatric hospitalizations, but a lot of those have to do with the fact that I'm bipolar. I
Right.
have a bipolar diagnosis, and the medications that I was mixing together were making me present a certain way at times.
Right.
Because when now you take away the substance, I'm not like that.
Right.
I still am bipolar and I have issues, but a lot of like the over the top issues that I was having, like having to go into psych wards and then give me an injection in my butt that would like totally knock me out for days, and
Right.
me fighting the people, like feeling like I'm
Mhm.
500 pounds, but I'm
Right.
5 foot tall.
Yeah, but you have that crazy strength, right?
Right. And I've been there so many times. I've been there where they've given me medication that made me feel so out of control that I couldn't wait for those meds to wear off.
So let me ask you about that and just dive a little deeper. So there's two big things. One, and you got emotional earlier. I don't want to go all the way back there, but I think it's important people understand that there is emotional pain here. When you were afraid you might not be you, and this will tie into the next thing. Did you have or feel an unreasonable level of fear about everything, or did you ever feel like you were afraid and didn't know why you were afraid? And can you just explore that psychological state from the vantage point of someone who's never experienced it, so people who hear this can really understand the state of mind a person is in when they arrive to help them via 911 when someone is
Right.
withdrawing?
I went from this woman that would get up and would put herself together and try to be a functionable addict, but I
Hmm.
had my cocktails that I liked. There were times I overdid it. There were times I didn't overdo it. But I went from being someone that's, educated and knows certain things and can have a conversation, to somebody that couldn't hold a conversation, to
Hmm.
somebody that was literally like a vegetable. I
Right.
literally went into this state where I wouldn't be able to have this conversation with you.
Hmm. Was that
It was
your
very
preferred
minimal.
state with the nodding? Is that like where you wanted to be?
Right.
Okay. And was that more toward
But
the evening, or did it hit a point where you wanted
yes,
to be there all the time?
so during the day, I like to just take what I needed to function and
Hmm.
get through my day so I could work and do what I needed to do.
Hmm.
I would reward myself
Right.
at once my workday was over and I got what I needed and I made sure, that's when the reward part would come into play. Hey Marie, you worked hard today. You deserve an extra. Hey, you deserve an extra pill tonight. We're
Right.
gonna have a good night. Like that's what my brain was telling me.
Right. And a lot of people do that. Some people do it with cookies or whatever. So in this state, here you are knocking down all the chemicals that sort of keep us awake and aware, and your body's trying to overwhelm that. And then all of a sudden, you find yourself in a state where you don't have anything knocking those chemicals down. And now you're getting this just plethora of adrenaline and dopamine and just all these things that are making you terrified, and you're worried if you'll
I was
become yourself.
sitting, I want to be very, very honest here.
Please do.
I have a lot of guilt sometimes about how I acted during that time to different medical professionals
That's okay. That's don't okay.
because
You're so
I
brave
was
for doing this,
spitting at people, spitting at people, cursing, just thinking that I was bigger than what I actually was. Like, like wanting to fight everyone off of me.
Well, and that's what we're here for, right? We want people to understand, and it's something I've said before on
Right,
the channel. You're not you. You're not you when that happens.
right.
And that's why we're here, right? We want to
It's
help
like an outer
people.
body experience
Hmm.
where like you're almost looking at yourself from an outside perspective. Like I could remember even being in jail and being in like the psych part of jail because every time I would first go in, I would need to be detoxed. And they
Hmm.
would put me in a suit. It was always that suicide suit that they would put me in because
Right.
that's the mental status that I was always in.
Oh wow.
And I could remember feeling like a fish in a fish bowl.
Oh
You
man.
know how there's like a fish will swim around. They only have a certain area that they could swim in that fish bowl. And
Right.
they just keep looking out. They
You
just
felt
keep looking
confined.
out at the world going on around them. And no matter where they're swimming in the bowl, the world is going around. I felt like a fish.
I'm so glad that you said that because it ties into the second part of my question. So you've hit rock bottom, it's fair to say, and now you're coming back out of it and you're asking yourself if you'll be normal. On the other side of that, though, when you're making active strides toward recovery, was there any part of you that felt like you would lose part of yourself without these things in your system? So you've lost
Absolutely.
the negative parts of it and you're happy to be free of them. But
You
now
know
you
what it
have to
is?
face your career you've built on them. How do you feel going forward in that?
I feel like I lost the love of my life. I literally, that's how I felt. Like the love of my life was now gone, and I had to grieve that.
Hmm.
It's a grieving process because at first it was fun. It was
Hmm.
so much fun. But the funness, when it wore off for me. I've been in so many situations where I should have never made it out to the other side. I've been brought to the hospital charcoal multiple times.
Hmm.
I've woke up in the hospital on, like I said, the respirator. I signed myself out that time AMA so I could go get drugs.
Oh wow.
I've ripped a catheter out of myself to get
Oh my
out of the
God.
hospital.
Wow, that's wanting to leave, man. That's
Well, hey, you know what? I figured, hey, the nurses just pull it out.
yeah, yeah. No, I get it, man.
You
That's
know, I've done that
yeah,
twice.
really. Wow,
I
man. That's
that desperate. And I left, I just ripped the catheter out and I left in the Johnny.
that's a powerful statement. It's a
Didn't even
powerful
care about
story.
my stuff, right? Just left because I've been discharged from the hospital so many times without clothes. Do you
Hmm.
know how mortifying that is?
Oh no, no, I
When
don't
you
know, but
get
I'm
brought into the
listening.
hospital and they cut your clothes off, it's obviously to save your life.
Hmm.
But then when they discharge you out, just in a paper gown, like there was never anybody to come help me in those situations.
Why now? Did you not have family close, or had they sort of severed ties with you, or?
At At that point, my family severed ties with
Mhm.
me. There was a point where they kept trying to do the interventions,
Mhm.
but interventions don't work. They
Right.
don't. It
Right.
is not the right approach. You have to meet people where they are at. And that was the issue. It
Mhm.
was always, you got to go to rehab and get off all the shit. That's a
Yeah.
very hard concept to think about when you're balls deep into it.
Right. Well, and then there's the question of then what? All right. So it's out of
Right.
my system. And that's why I wanted to talk about that, because there was obviously, you've explained times you left because you wanted to go get drugs, right? So that plays a factor. And then it hits a point where you're quote unquote clean. I don't like to say clean. I like to say better, right? So
Right.
you're better. You've got the stuff out of your system, but now you have no family network. You have all of your friends. Everything's been built around this lifestyle. Even your career, a lot of people know that they cannot do the job they're doing without this stuff, and you have nothing to go back to if you take that out. And so a lot of relapses are contributed to by that. And I've seen it happen every way. But one of the ones that I just want to elucidate here on this podcast is like manual labor jobs, construction jobs, a lot of drugs and substances in there. So guys are like, nope, I'm cleaning it up. Maybe they find religion, maybe they make a promise to their wife or their family or whatever. They get on the job. Now, they've broken their body down 10, 15, 20 years doing construction, and it hurts. They're barely able to walk around, and their friend says, hey man, just take one to help you get through the day because
Right.
you're hurting. I can see it. And your friend's not trying to get you back to a terrible place. Your friend's trying to help his friend. Fast forward 2 weeks, and it's like you didn't just have that full experience you just had. And it's that easy, and it's that simple, it's that quick.
It is
It's
that
it's
quick.
it's not always a conscious decision to go to the worst place ever. Sometimes it's like you watch it happen. And I want people to understand that, you know?
Absolutely. I agree with you. I get so many messages from people struggling, and so many people don't know where to turn because there's a stigma when it comes to medicated assisted treatment. And I would like to discuss that.
I want to talk about that too. So I've seen a meme. I just want to start the conversation with this. I've seen a meme. It pisses me off to no end. It says Suboxone is not sober. That
Right.
make that makes me so angry. It's just like when someone makes fun of the out of shape person in the gym, right? They're there to better themselves, and you're going to shit on it and ruin their confidence this early in the process for what? Why? You started maybe, excuse me, maybe you started there and you don't want to admit it, right? Maybe, or maybe you didn't. Maybe you were fortunate enough you grew up in an athletic family and you don't know the struggles that they have. But either way, it's none of your business how someone gets better. Let them go about it the best way, whether it's physically, whether it's getting off of medication, whether it's controlling their diabetes.
Right.
So I want to
We
talk
need,
about that stigma from your end. Can you tell me how you feel and the things that you've seen or heard, especially from healthcare providers? I want to call healthcare providers out on the carpet here.
wow, from healthcare providers, I feel like I've gotten it the worst, to be honest with you.
Tell me about it.
I am somebody that also struggles with chronic pain issues myself. I have lumbar disc and facet joint issues, and I get a lot of pain, like nerve pain that radiates down my leg. And I got a lot of things going on with my physical health. Unfortunately, I don't get that treated because my experience with pain management doctors being in recovery is abstinence. There's nothing I can do for you except for injections. And my doctor has given, like, I've gone down the injection route and it hasn't really helped. So I just feel like less is more for me at this point. Just
Okay.
don't do nothing about it.
That's that's horrible.
Which
You know,
sometimes I have to admit, for people in recovery, and I want the medical professionals to know this. People in recovery, pain is a trigger.
absolutely.
Number one trigger for me would be that a doctor left me in pain and I had to figure it out myself.
You know, when you're left to your own devices, what are you supposed to do sometimes, right?
Right. But I feel like it happens all the time now. There are so many people in the chronic pain community and recovery community that are undertreated because doctors are scared now because they're scared to lose their license. They're scared to give certain medications. They don't want to combine a benzo with an opiate anymore.
Right.
But some people need that. For some people, they need that.
No, I agree. And this is one of the problems that has plagued medicine, modern medicine, since the beginning is what's called the knee-jerk reaction, where we will have things go south and then we will completely snatch it away. And
Right.
it's not just in medication prescriptions. I've seen it in ventilatory techniques like CPAP and stuff like that. So it happens all the time. It's also a huge problem when we have litigators, we have people that write the laws who are not doctors, who don't listen to doctors, or the doctors that they listen to haven't practiced medicine in 30 years, right? You know, I want to see it from everyone's angle, but a previous history of addiction doesn't mean your body doesn't hurt anymore. Now, if you have to have tighter controls, maybe you need to have your prescription filled once a week. Why don't we institute a program like that? Or you know what? A person could, if they have the means and the ability, they could go to the pharmacy every other day. So you can't take too much, whatever it takes to instill those good habits. But we're not doing that at all. What were you going to
Right,
say?
like a safety plan. They need to put like a safety plan into place because it's the truth. There's so much stigma that surrounds medicated assisted treatment. And I want to say this.
Mhm.
If I didn't get myself on Suboxone, I truly believe that I would not be sitting here having this conversation with you today because that medication saved my life.
That,
Now I'm not
yeah.
on it anymore,
Mhm.
but I always guide people towards medicated assisted treatment because I believe that even if it's a safety net, I
Mhm.
because there's so many times that people go out and get a one and done pill situation. One and done.
Mhm.
Fentanyl, fentanyl poisoned,
Yep.
done.
Yeah.
And I believe that medicated assisted treatment, now it might not be for everyone. Everyone recovers differently. And
Mhm.
that's the beauty in finding your own personal recovery journey.
Right.
It's not one size fits all, it's unique. You have to look at everyone as an individual. Some
Yes.
people have more past trauma, some people are more healed than others
Mhm.
in their recovery. Like when I look at the recovery community, I could see some people have more healing time than others.
Right.
Like, it's just apparent sometimes.
It's not just what happened to you, but it's how your brain can process it, and whether or not it's something you can reconcile. Some things happen to people, especially when they're children, that your brain will never be able to make it make sense.
Right.
You know,
I don't remember a lot of my childhood. I want to say that. I'm working on it in therapy right now, but it's something that bothers me because sometimes I wish I did have more memories, but I
mhm.
don't. But sometimes that could be a good thing.
Sometimes, yeah, and sometimes
Right.
it sort of alludes to what it was like if you can't remember it because you might have been jumping from survival situation to survival situation. The one of the big things you were talking about fentanyl, um, I just want to state it plainly for the record that, I did 2 tours to Iraq and I put more kids in bags from fentanyl than I did because of war. And
Oh,
I think that is something that very plainly states how we need to approach this, because if we do not expand our recovery procedures, processes, options, whatever you want to call it, that's going to continue because your only choice these days is a rock and a hard place. I'm a big fan of Suboxone. Personally, I've never had to use it, but I have seen it give people their lives back. I have also had close friends that are now dead because of fentanyl. One of them, tragic, so hardworking dude, got in a bad car accident, was disabled for more than 90 days. So he lost his healthcare insurance and his job, had to self-medicate. He's still in a wheelchair at this point in time, right? That's how broken and busted up he is. And so he started using illicit substances because it's what he could afford and what he could get his hands on, right? So this is not a person doing this to get stoned out of his mind. He's still unable to walk 3 months later, and they found him overdosed in his home because what he got had fentanyl unbeknownst to him, and he's dead now. He left behind a wife and child.
That
Go
is
ahead.
absolutely heartbreaking. And a lot of times, I want to make this very clear, people aren't going out seeking illicit fentanyl.
Mhm.
It's in everything. I
Yeah.
have a friend that relapsed at one point, and when they went to get drug tested, the doctor was like, "Do you know that there was fentanyl in your urine?" And they were like, "No."
Hmm.
Because you're not even realizing that all of these substances are pressed pills. The majority of the pills that you're getting, if you don't see it come directly out of the pharmacy,
Yeah.
it is probably pressed.
It can make, like you're talking about, that burst of energy you got. It can make bad cocaine seem like better cocaine. It can make bad ecstasy seem like better ecstasy. It's icing that you can use because it gives you that rush of
Right.
dopamine. And unfortunately, street pharmacists are usually not very good at math, right? And fentanyl, pound for pound, just to illustrate to the world how powerful fentanyl is, right? So pure fentanyl. I was close with some of the guys that were on the equivalent of a SWAT team. Let's say that I was going to do a little work with them, and I didn't really get to do extensive work with them. But they showed me what they had seized. It was a golf ball sized amount of fentanyl. So that's 13.8 grams. So 13.8 grams, about the size of a golf ball. That is enough to make 138,000 vials of what I carry on an ambulance.
Wow.
138,000 vials. So this powder is unbelievably strong. It binds to the receptor in an unbelievably strong way. So a pencil eraser sized amount through your nose is enough to overdose on. It's so much more potent than heroin. You have to understand that the reason heroin is a class 1 drug, it used to be an opiate that we used. And then they invented the hypodermic needle. And this is way before Narcan, and they say this stuff is so strong it kills people when we inject it, because they didn't fully understand, in those days, that when you inject something, you use about half as much as you would take it by mouth. This stuff is so strong you can eat it and OD, a pencil eraser sized amount. You can eat it and overdose. That's how strong this stuff is. And it's in everything. It's every.
Right. I want to make that clear. It's not just in when you're going out seeking opiates, it could be in cocaine,
Mhm.
it could be in Adderall. People that are studying for tests that are in college are not waking up because they're thinking they're grabbing an Adderall pill to
Mhm.
keep them stimulated to study. And they're not waking up in the morning because it was not an Adderall pill.
That was one of the I'm gonna call it a mind blower. I'm not gonna use the word that I usually would use for that, but
I know.
when I went into cocaine overdoses, and a cocaine overdose is high blood pressure, a lot of times a stroke, super fast heart rate, and I saw someone laying there in a coma not breathing. And the fentanyl is so powerful it overpowers cocaine.
I also want to say this.
Mhm,
In today's society, we're dealing with xylazine,
mhm.
nitazine. There's the new one, the alpha 2 antagonists that are out right now are very hard because Narcan doesn't work for that.
Yeah, these new designer drugs that's exploring levels of chemistry that are not mapped out. It's not basement chemistry. I mean, these are smart people that are making it. And I think that there's a certain amount of it that's leveraged in a geopolitical context of one country trying to destabilize another. It wouldn't be the first time in history that's happened, so you have to take that into account. But you have to understand that this is not going away anytime soon. And we've never been able to keep substances off the street, right? Anytime the government wants to ban something else, I say, hey, you know what? As soon as you catch up on that whole meth and heroin thing, you can ban the next thing, but you need to finish what you've done first, right? The point there being that we can't get rid of things. They're always going to be here. So how can we curb it? We have to make people not want them. It's obvious that jail time and ruining people's lives is not going to do that. The war on drugs was an abysmal failure.
Right. I
Um,
think the DARE program was a huge failure.
right. But if we
Huge.
if we could give people viable options to reclaim their life, and we could tell them, here's the deal. We're not just going to focus on getting this out of your system. We're going to give you your life back. We're going to get this out of your system. We're going to establish a baseline. We're going to make you feel like a normal human being. We're going to work on pharmaceutical options that don't change how you act necessarily, but they change how you feel. we're going to give you a shot at a normal life you never had, which is probably how you ended up here.
Absolutely.
If we can do that, people won't want it. And we've seen this happen. The analogy I like to use, because my family's from Appalachia, is moonshine, right? So you see a little moonshine. Oh, I'm coughing. You see a little moonshine here and there, right? That's just things people have. It's a novelty. But do people constantly imbibe moonshine all the time? No. Why? It's not because it's illegal, because it's insanely easy to make and hide. You know why? Because it's not safe. It's not as safe as the regulated substances that we have in the liquor store or whatever the case may be, right? So if we had a more regulated system, if we had a system that gave people viable options to have their life back, I think we would see people voluntarily turn away from them, because it's like you said, interventions don't work, right? And it is
And I
so,
also think it needs to be like a wraparound system, because a lot of past trauma you have to work on your past trauma in
yes.
order to heal. I believe that therapy is a huge key to a successful recovery journey. That's my own personal beliefs, because that's what personally worked for me.
I think
I
the
needed
numbers
to
back
work
that
on
up.
everything. Like, my mental health is something that I really put in a lot of time and effort for.
And good on you for that. I think a lot of people also misunderstand that. I think a lot of people feel like they were born with perfectly normal mental health and they messed it up.
Right.
I don't think they fully grasp that there are so many things beyond your control that affected your mental health, that landed you wherever you're at in life, whether it's a good or a bad place, that it's okay to understand you didn't start with a clean slate, especially if you were born in the past 40, 50 years. And honestly, to that end, I feel really bad for the young guys right now, because the world's ending every 5 minutes if you turn the news on, and everything's vote for your life and everything's good and evil. Like this is, and it's so perverse with social media. It's in their face. These kids,
Right.
they live in a constant state of crisis aversion. The worst is yet to come if we don't curb how we sensationalize everything. And we're going to have options to help people reclaim their life, because it's almost taken from them the minute they sign up for Instagram.
I
You know what I
really
mean?
feel like a lot of people live in fight or flight mode.
All the
Like,
time.
constantly high levels of cortisol, constant stress, like life these days. I don't even turn on the news. I'm being honest with you. I don't turn it on because
I don't either.
it bothers me to turn it on.
I get that. I think just fun fact, I had this conversation with somebody. I think that's America's fervor for levels of caffeine it's never wanted before, and energy drinks and all that is a product of that. I think it's to be able to maintain the awareness it takes to exist in fight or flight mode all the time, because that's what it is. I mean, you're told all the time that there's somebody around the corner waiting to get you. We inundate our kids with stranger danger and stuff from the very beginning, and we're always taught that the whole world's trying to kill us all the time. And on top of that, you've got your office politics and things you got to negotiate, and passive aggressive behavior is acceptable now. So now you have to watch people say one thing and do another, and people live in a constant state where overthinking is now a life skill, right? And I think that's part of it. They have to maintain that constant state of readiness, but I think it ruins people. I don't
I
think
agree.
I know it ruins people. We have documented proof of that. We're seeing more and more kids that live a normal life, and yet they exhibit the behavior of the abused child. And I think it's because just mentally you are so taxed all the time. But anyway, let me get out of that. I want to talk about Marie. I'm sorry, I go off on
No, you're
tangents.
good. We're
That's
good.
the
We're flowing.
So you've had this really bad experience. You've hit rock bottom. I think we established. Could you please talk about your thought process where you say, I want Marie back? How do I reclaim Marie?
So, I had gotten to a point where I did not lose my kids once, but I lost them twice to the
Oh no.
TCF.
Hmm.
That was the biggest shame and embarrassment of my life.
I'm sorry.
To be able to have a child and lose that child not only once, but twice because of my actions. One time was because of an accident. So the first time that I lost my kids, my daughter, I had two kids at this time. My daughter was a preemie, and I had just become a mother of like learning how to have two kids at the same time.
Right.
That for me was a difficult adjustment. I'm not going to lie. I had postpartum depression. I told the doctors in the hospital that I was on Oxycontin at the time. I was on the benzos. Everything was, I thought, controlled and prescribed.
Right.
Right
Mm-hmm.
now, my son was exhibiting behaviors that were abnormal. So I started reaching out to the pediatrician, like he was slamming his head on the hardwood floor. He was throwing big toys across the room at me. Like, I'm like, what's going on? I was trying to have that evaluated and looked into.
Right.
So I thought I'm doing the right thing. I'm reaching out, I'm looking for help. Well,
Mm-hmm.
it backfired in my face because one day I'm home making a bottle. I turn around, I'm walking back with the bottle. My daughter, who was a preemie, was in the bassinet. The bassinet was like on wheels,
Mm-hmm.
and it had like shelves where you could put like diapers. It was wooden and like oval shaped.
Right.
My son climbed up there. He grabbed my daughter. When I was walking back with the bottle, he dropped her.
Oh no.
That drop right there was what pretty much put me into a tailspin of worst addiction.
Oh no.
I brought my daughter to the hospital. She had a closed skull fracture.
Oh no.
They transported her to a different hospital, Children's Hospital in Philadelphia, from New Jersey to Philadelphia, so over state lines. But when I was at the first hospital, they're like, Mom, don't worry. Accidents happen. Things happen. It's not a big deal. This has happened before with babies. Like, she'll be okay. You'll be okay. Everything will be okay.
Right.
We get to the next hospital. I'm in the room with my daughter all day. We finally get in a room. My children's father was there with my son, who was 3 at the time. It was like 8 o'clock at night, and I was just at my wit's end with being in the hospital, what just happened, everything. I
Right.
told him, I said, listen, go home, take him home, go put him to bed, come back up to the hospital tomorrow. I'm just gonna stay here overnight. He leaves. Within an hour of him leaving, all of a sudden about 20 people come outside the room. It was detectives. It was DCF.
Oh
It
wow.
was the hospital staff. It was Philadelphia police. It was New Jersey police. They brought me to a room where I could remember what the room looked like because it was so blank. It was one of those rooms that they bring you in to tell you bad news.
Oh man.
And they brought me in this room to tell me that I no longer had custody of either of my children.
Oh my God. So they suspected abuse.
So, yeah, because I said I had postpartum depression.
Oh
And the
man.
fact that I admitted that I'm on all of these medications.
So I don't want to make light of it, but just to highlight your honesty made the situation worse.
Right. I feel like because I opened up and I was like, I did have postpartum depression, but I'm getting treated for it now. I'm on depression meds.
Mm-hmm.
And just they because I didn't call an ambulance and I had my kid's father come pick me up because I thought he could get me there quicker. That was
Right.
mistake number one. So they
Right.
didn't like my way of thinking was
Mm-hmm.
so
Oh man. I'm
that
so sorry, man.
is okay. So I lost my kids that day and I was no longer welcome at the hospital. I was no longer welcome in the room with my daughter.
Oh man.
That right there didn't stop me from wanting to use.
Oh man.
That made it 50 times worse for me. I
I
couldn't stop because my kids were just ripped out from underneath of me, and I had no idea what to do at this point.
oh
I
my
had
God.
no family that was willing to help. My mother and father and my brothers were like, your kids, your responsibility. Sorry. And that's just the way that it was.
Man, I wish this wasn't remote. I want to give you a hug so bad right now, man.
It's okay.
I feel bad.
So that right there, I want people to understand how sick somebody with addiction really is, because you would think that them coming up to the hospital and removing both of my children, my son was taken at 2 o'clock in the morning out of his bed, brought to a stranger's home. My daughter was sitting there in a hospital room with a closed skull fracture with a mother that couldn't even be present in the room anymore.
Oh man. I can't imagine.
Here I am in another state. I had, I did not know what to do. I just started using more. I started taking more benzos. The benzos were handfuls by this point because I was in so much physical and mental pain that I didn't know what to do.
Anything to make it better, right?
And I didn't have the right support in my life.
Mm-hmm.
I was hanging around the wrong people. I didn't I didn't have no self-love for myself. That's where I want to start, because people that are struggling with addiction really don't have any love for themselves. Like, I looked in the mirror every day and hated what I saw, hated the person that I became, hated the mother that I was.
Oh, man. That's tragic, Maria. I'm so sorry.
And I thought, so my daughter was taken, she was like 60 something days old. I thought I ended up getting on methadone at that time. But this is the issue. I was not only getting methadone from the methadone clinic, this is how screwed up I was. I was not only getting methadone from the clinic, my doctor was prescribing me methadone for my pain. So
Oh,
I was
wow.
double dipping the methadone. I was buying methadone take home bottles from people. My doctor had me on a certain amount of Xanax. They would be gone in 2 or 3 days tops.
Oh,
Tops.
wow. Wow.
And my addiction started to spiral. But I was at this time, as my addiction spiraling, I'm trying to present myself so that I could fight for my kids, trying to do a DCF service plan, trying my hardest to jump through the hoops and the parenting classes that they wanted me to do, and the psychological evaluation that they wanted me to have. And there was a point where DCF was controlling my life to the point where I was no longer. So my son and my daughter ended up getting separated in foster care
Oh,
because
God.
they saw that my son was like throwing things and being rough around the edges, the same things that I kept saying that I
Mm-hmm.
saw.
Right.
And nobody validated those concerns when I brought them to their attention.
Oh, wow.
So now all of a sudden everything's getting validated. Oh my God, there's something going on with him. Like,
Talk
so
about,
they thought that
yeah.
he was unsafe. So they put him in multiple foster homes, multiple group homes, to the point where he got kicked out of the group homes and sent back with dad. But I wasn't allowed to live in the house. So now I left so that my son could go back with dad. And I had nowhere to go. So
Oh, my God.
my parents allowed me to stay with them, but it didn't really work out for that long.
Right.
I was staying with them. I was doing weekend jail at that time because I had shoplifting charges that I owed weekend jail time for. So I would go to the clinic in the morning, then I'd go to weekend jail. Like, I was in a very bad place. I was still stealing from stores to support my addiction. So I caught a few more charges while I had a DCF case. Needless to say, I worked hard. I got my daughter back by the time of her first birthday. But my addiction wanted to tell me lies.
Hmm.
My addiction wanted to reward Marie for
Right.
getting her back, for working hard, for doing the service plan, for doing what I was supposed to do. I wanted to reward myself. And the way that I rewarded myself was by taking what made me feel good.
And it's important to note here, I think, that you were successful in getting your children back. So that lends credence in your mind to, I can handle this.
Right.
Right. It gives you the reasoning you need. You know what I mean?
But during that time when I thought I did so much hard work, now looking back, I needed a lot more mental health help than was provided to me.
Right.
I really needed somebody to sit down and really learn why I was the way that I was and why I needed to self medicate and why I couldn't get up and just function like a normal human being during the day.
Right.
But all the doctors that were court ordered by DCF were not helping me.
Yeah. A lot of times you're just a number in that system, right?
Right.
It's
I was
overtaxed.
just another mandated girl that needed to sit in the parenting class that day.
Yet another reason to put a more human face on this, right? It's it's gotten so bad it's to the point that they can look you in the eye, they can meet with you weekly or monthly and still completely disregard everything going on right in front of them, which is
Right.
it's a
So
tragedy.
it's like they weren't really seeing me for what was really going on.
Right.
So I, being an addict, was very easily able to manipulate a lot of that.
So
I
what
never
happens
had an
from there? Yeah.
ulterior motive, like, oh my God, when I get my kids back, I'm going to use. It was
Right.
never that.
Right.
About 6 months later, I just had a day where I felt like I needed a benzo,
Mm-hmm.
and I got a benzo, and it happened that quick, the slip up.
Mm-hmm.
By the time that I did that slip up, I started calling in benzos myself.
Oh wow. So you were, I guess, impersonating a healthcare provider, or
Yes.
what happened there?
So I did that multiple times. So what happened was is I was living in New Jersey. I had a DCF case with them to the point where they told my kid's father, if you don't get away from her, your kids are going to be permanently gone.
Wow.
So he comes to Massachusetts where he has family, but he took me with him.
Hmm.
So it was supposed to be like a hush hush thing,
Right.
but he had, so basically looking back now, he should have never had me around the kids, and he did.
Right. He didn't want to break up the family though. He
Right.
was,
And a
yeah.
lot of things got pointed on me, like, but he should have known not to leave me alone. So what
Right.
happened was we got to Massachusetts, we got a place. I really shouldn't have been staying there. He needed to make money. He was working with his family. He needed to travel to Virginia. He leaves me alone with the kids to travel to Virginia when I'm withdrawing off of opiates and benzos.
Oh my goodness.
And I'm in a bad place mentally
Mm-hmm.
because when I left New Jersey, he was like, I promise I'll get you into a Suboxone doctor. I couldn't get into a doctor for like 2 months.
Wow.
So I had to do what I had to do. And I didn't want to go look for pills on the street because I didn't feel comfortable because I knew there was fentanyl. I
Right.
was afraid of that. I wanted to get the right thing just to get me right so I could get up and be a mother.
Right. Right.
But he also left me with no money.
Mm-hmm.
So how am I supposed to get what I need when I'm sick? I got
Mm-hmm.
2 kids sitting here. You leave me and leave the state.
Right.
And he really technically should have never left me
Mm-hmm.
because I was in a very bad place mentally.
Mm-hmm.
And I chose to, I knew it worked before. I was calling in benzos, impersonating my doctor from New Jersey. I had the number from the top of the script. And I would call and I would just say, hi, like my patient's never been there. They're out of state for a funeral. I need to call in a prescription for Xanax. And they would tell me, okay, but you need to fax the hard copy. I would say, well, I'm out of the office right now. I'll have the girls fax it. And they would fill the scripts.
Oh
And it
wow.
got filled in multiple pharmacies. Multiple times I went
Wow.
in there and picked up scripts for fake names that I made up,
And
fake
what
profiles.
year what year is this?
This is like 2000 and like 9, 8, 9,
Oh,
around there.
so they had the technology to check this. There wasn't a lot of vigilance on their part, it sounds like.
Right. So
Mm-hmm.
I was getting away with it. And then I was using one of those cards, the discount cards, to make the prescription. Like, I was getting 90 Xanax for like $9.
Oh, wow.
So
You got a whole
instead of,
system here. Yeah.
right. So I finally had like this genius thing that was working for me.
Right.
There were times where I would call the pharmacy and the pharmacist would be like, I'm calling the police. I know exactly what you're doing. I would just hang up and I call another pharmacy.
Oh,
Because
wow.
guess what? I needed what I needed, and I needed to make sure that it was coming from the pharmacy and safe.
Wow. It's
Because that,
so wild how it all gets, twisted. You know what I mean?
right, but that was important for me because at this time I knew fentanyl and stuff was, I knew the
Mhm.
press pills were just emerging, like around this time, like 2010, 11, 13, like in those years.
Right.
So I'm off on my timeline a little bit because it's all a blur sometimes for
Oh,
me,
no,
to be
no,
honest.
that's okay. No, it's all right, man. This
But
is all good
what
stuff.
I'm saying is like I would have the balls to walk into those pharmacies, hand in my ID, and pick
On
up a
yeah, on
prescription.
camera, yeah.
Right. One
Wow.
time I walked into the pharmacy. I just got discharged from a psych hospitalization.
Wow.
I I walked to the pharmacy. I walked in like the snow to the pharmacy. I get there. I didn't know how I was going to pay for the meds because I had no meds. I stole something from the pharmacy so that I could get a gift card, a store credit, so that I
Right.
could use it at the pharmacy. I just grabbed something and took it back, acted like I needed to take it back. Walked right
Wow.
in there. So I would know how to get these meds super cheap because I knew I'm not paying $5, $6 a pill on the street. I
Right.
didn't have the money.
Right.
So I needed to figure out a new way, and it was working. One time I was standing at the pharmacy, up one aisle comes the cop, up another aisle comes the cop, and I'm standing there, and they're like, "You're picking up these meds." Like I said, dude, that they were my ex-boyfriend. He called me and asked me to. I manipulated them to
Wow.
let me leave that night and issue me a court date in the mail, and that's what happened. By the time I went to court, I had 3 felony charges
Oh,
for
wow.
calling in prescriptions. They wanted somebody to put like their house up,
Oh, for your bond.
right?
Wow.
So I had 10 years suspended jail time hanging over my head. And guess what? Guess who gets pregnant during this time?
Oh, no, man. It never rains, but it pours, right?
Yeah. So
Oh my
now I'm
God.
pregnant. And I'm pregnant. I got on the Suboxone. And well, first of all, I got on the Suboxone and I started doing the right thing.
Mhm.
And it was working for me. I started noticing like I'm not having cravings. My mental health is better. I
Mhm.
didn't feel the need for the benzos 24/7, but I was really still fighting that war inside my head
Right.
because when you numb yourself to that extent with benzos, it's hard to feel anything.
And no, I get
Happiness,
that. I get that.
joy, happiness, normal feelings don't feel normal to you. You almost feel like you don't deserve to feel those feelings.
So you question your self-worth and all that in
I've
this.
always questioned my self-worth. I was always the girl that would be in high school sitting at the table while everybody has their lunch tray, me opening up my purse to take a diet pill out
Oh, wow. So
at a young age
is it
because
just self-image, or did you struggle with your weight, or did you have an eating disorder?
I think I definitely had an eating disorder and I struggled with like body dysmorphia and body image from a young
Right.
age,
Oh, wow.
which later on led me down another road that I could get into. But what I'm saying is all of these things in combination, like the way I hated myself, the way I hated myself for losing my kids.
Mhm.
Self-hatred is something that needs to be addressed in recovery because a lot of people hate themselves so much that they don't feel they deserve to get clean.
You know what? I love that you articulated it that way. Do you or are you able to pinpoint a root or a cause or something that led you down the path where you began to dislike yourself before all this, early
So
days?
Right. So growing up, I grew up in an Italian family. I had older brothers. I could remember them like teasing me about my weight.
Hmm.
Or when it would be dinner time, they'd be like, "Oh, you're gonna eat that extra," like, and it just planted a seed in my head. And I
Right.
did struggle with my weight throughout my life. There's been times where I've been heavier, and
Hmm.
there's been times where I've been super thin.
Hmm.
And I always tried to find that balance. And I always felt like my worth depended on my weight for some reason.
Well, I think that's an important thing to highlight, especially in Western society now with your Instagram models and your used to be magazine covers
Filters,
and
all of
things,
it. Right.
yeah, now there's this model of what you're supposed to look like, and people, they see the doctored photos on Instagram, and that messes us up because we think that's real people. We used to didn't worry too much about a magazine cover, right? Because that was a quote unquote model, but now people are trying to make it seem like they look like that all the time, and
Right.
that's not how people look. That's not how the human body looks, normally or after a baby, anything like that. I think it's harder on females because especially in well, many societies around the world is your suitability to find a good mate is so dependent upon how you look, and if you fit an aesthetic, that's got to be a huge amount of mental
Well, for
torture,
me, and I think for a lot of people, this stemmed with me being cheated on all throughout my life. It caused like a major thing inside of me where I'm like, every single relationship, but I've only been in a few relationships. Like I was in that relationship with my high school sweetheart from the age of 13 to 25. Then after him, I had like 1 2 year relationship, and then I met my kid's father. So it's
hmm
been like three relationships, and in each one of those relationships, I have been like serial cheated on.
So are you saying, I guess, that you questioned if you were good enough or pretty enough to make them maintain monogamy? Is that what you're?
Yeah,
Okay. Oh, wow. God, that's a mind fuck, man. I'm sorry. That is
yeah, but it
horrible.
is the
Yeah.
truth. I feel like a lot of women feel like that,
Hmm. Yeah.
especially when it's like a constant thing. Because for me, it's always been like that. And it's like, it does. It makes you question, like, what is so broken within myself that
Right.
I'm not good enough for anybody?
Right. Oh my God.
Right.
Yeah. That's man, and that really highlights, I think, what a lot of people go through. Maybe it's reasonable to say males and females
Right.
when
I
it
think
comes to
it's
that.
both.
You know,
It is
males
both.
males they also get the dysmorphia thing, and usually find those guys in the gym, and then they're told lies in the media, especially by bodybuilders. They're like, all I take is creatine and protein. Yeah, right, bro. Okay, sure. And so these guys go and they work out, they put their soul into it, and then they don't look like the guy on the magazine. And it's, why am I broken? What's wrong with me?
Right.
And I think women feel the same way.
I went down a very bad plastic surgery whole tailspin because of it, to be honest with you.
Really,
Right.
what happened there? And I think that's important to your addiction story because it's all a quest for happiness and contentment, right?
Right. So I, like 5 years into my recovery, was sitting on the couch one day, okay, thinking that I was an active mother. I used to like sit around and watch a lot of YouTube with the kids, but like
Hmm.
I wasn't as active as I should have been. I was almost 200 pounds at the time. I'm 5 foot tall. So that's
Hmm.
obese
Right.
for someone 5 foot. I started to realize, like, damn, Marie, you're morphing into somebody that you don't even recognize at this point. Like,
Right.
who is this girl becoming? And I started letting myself go.
Mm.
And I was content with it for a while. But there became a point where I said, just like with my recovery with my addiction, it's either I get myself now or I
Mhm.
don't.
Right. Right.
And I went to a doctor, and it was like a holistic medicine doctor. And I talked to them, and I first and foremost said, listen, I'm in recovery. I was kind of wanted some sort of medicine. This is before the Ozempic and Manjaro and the whole,
All that good
and
stuff.
they had like, they could have used like Topamax, or I was looking for something that wasn't gonna like peak that like addiction piece,
Right, right.
a non-stimulant. And
Hmm.
he was like, "Oh, you need to go on the Mediterranean diet." And I'm
Yeah.
thinking, dude, I know I need to go on a diet. I'm not here for you to tell
Yeah.
me that. And I got pissed and I
Yeah.
left.
Well,
And
that
I'm
would be
like,
kind of insulting. I mean, you're Italian. You grew up on the Mediterranean diet. You
right.
know
And
what
I'm
I
sitting there
mean?
thinking this. I'm like walking out going, you
Yeah.
know, but that was a pivotal moment because from that moment on, one of my friends during COVID wanted to get a tummy tuck.
Hmm.
So she needed to lose 25 pounds in order to get her surgery.
Hmm.
So I was like, I would love to start walking with you on a daily basis. Let's do it.
Right.
So we started walking the local high school track. And within like a month, 20 pounds fell off of me. And it was like extremely noticeable.
Awesome.
And that right there, I was like, yes, my work's paying off. And it felt rewarding,
Hmm.
but it also got addicting.
Right. So you started chasing that. Now, did you
I
get to an
started
unhealthy
chasing
weight?
that dopamine feeling.
Hmm.
And I started making a routine. Like I would never miss my morning walks ever,
Hmm.
ever, because I started to realize it wasn't about the weight, the daily walks. It was helping my mental health more than it was doing anything else for me.
Right.
And having that help my mental health made me want to keep on, keep it on.
Right.
So I started going down this journey of like, I'm going to walk every day. And a lot of the things were remote during COVID. Like my therapy sessions became virtual, like
Hmm.
just talking to my therapist over the phone.
Hmm.
So I would schedule my therapist while I was walking.
Hmm.
And it started to give me like, I'm moving, I'm grounding myself during these therapy sessions,
Right.
and I'm getting so much more out of it.
Awesome.
And
Now,
it
have you ever
became,
taken it too far?
yes, I have.
Okay.
I if you see my treadmill behind
Yeah,
me,
I do.
I got
Yeah.
myself a treadmill because I didn't want to miss the days that it rained.
Hmm.
But I got myself to a point where my psychiatrist was like, Marie, like, I know that you're starting to really love this, but like, slow down a little bit on the working out. And I got very hyper focused on my body. I lost 75 pounds during that time.
Oh, wow. I
Right.
mean, congrats, but I feel
Thank
like
you.
there's a butt coming. You know what I
I
mean?
worked it like I walked that shit off, like walk, walk, walk. Then I
Walk it
started.
off.
So at this time, I was a heavy smoker, a 2 pack a day smoker, Marlboro Reds.
Hmm.
I'm like, you know what? Walking like this and this smoking and buying a treadmill and learning to love, like to start to run on the treadmill
Hmm.
because it was helping my anxiety. I started to realize that, you know what? I like it was becoming too much. And I just started to realize like I got myself in this place where I started to say to myself, you know what? I when I lost the weight, I started to get dysmorphic. Like I realized my boobs were gone. I'm like,
Hmm.
you know what? I was proud of myself because here I am in recovery. I was able to save some money. I had money in the bank. I had money saved. I'm like, you know what? I'm going to treat myself to getting my boobs done because
Right.
whatever.
Right.
And I wanted to do that because I felt like I was missing part of my body that was no longer there, that was always there.
Right. And it might have been something that was an attribute you were proud of and you wanted that back, right? You wanted
It
that
just
pride back.
it
Yeah.
just felt weird having no boobs anymore. So
Right.
anyway, I researched, I did the surgeon around here. I made a huge mistake with that. And I ended up getting capsular contracture and like
Wow.
an issue within 7 days of having my surgery done. Like
Oh my
my
goodness.
one boob was up here and one was down here. And I walked around for a year so ashamed of myself because it was so noticeable,
Oh
the
no.
difference. It was crazy, the difference. So when I had to do a revision, I started looking into getting a revision. That doctor, like, I was like, you know what? I might as well just get the tummy tuck. I lost 75 pounds. I had a loose
Hmm.
skin. I said, if I'm going under again, F it. And that's what I did. I
Right.
did that surgery. And within 7 months of that surgery, I got capsular contracture again.
Oh no.
So I just had my third revision for capsular contracture.
Oh
where they put
man.
in like Alloderm. But I went down a vicious cycle of like almost another addiction
Mm-hmm.
to bettering myself.
Because you're chasing that contentment and that easement of disliking yourself and self-hate. I get that maybe more than you think. Here's a story I've never told. So I got really out of shape after the service, and I it just that was part of my manhood, right? How strong I was, how much I could do, that kind of thing, and I had lost it. And so when I decided to get back into it, I mean, blood work, I'm getting healthier. And then it started to hit a cycle. I had to work out 7 days a week, or I felt like I just wasn't doing anything. So my body, my joints, everything starts breaking down, but I can't stop. So I would take, Tylenol or ibuprofen and go to the gym. And when that didn't work, I would take like a kratom shot from the gas station just to go to the gym to loosen my body up to be able to do this stuff. And I ended up in an MRI machine because I had grabbed, I grabbed the 200-pound dumbbells because that's what I used to be able to press. And I was like, I'm going to press these. This is happening. And, I get them, kick them up, throw them up, and I start dropping it down, and I feel it right here. It
Ooh,
feels like tearing a washcloth. Or have you ever had a t-shirt and you tore a piece off?
right.
I feel it as it comes down. So I put the dumbbell down really easily, and now my arm's hanging funny. And I remember in that moment, I was so far gone. I know what's happened in my body. I do, right? I'm a medical
Was it
guy.
your rotator cuff?
No, it literally tore a hole in the pectoralis. And I remember being thankful that it wasn't the tendon. I was like, the muscle will heal. It's fine. It's no big deal. And so I'm in an MRI machine. And then after that, I'm looking at, it looks like a rip in fabric in the pectoralis muscle. And I'm staring at it. And my first question to the doc is, when can I get back in the gym?
Right.
What's it going to take? And that was on the way home. I thought, you're crazy, but it was another addiction that I had substituted. And just like any other addiction, it was tearing up my mind. It was tearing up my body. So I looked healthy, right? But I'm rotten on the inside because I'm eating, just this plain stuff, just chicken and veg, and I'm taking all these vitamins and supplements to make my almost 40-year-old body do what my 20-year-old body couldn't. I want to do all these things. And I was chasing the dragon. You know what I mean?
Right.
And
There's
that
a healthy
was
balance
crazy.
to everything.
That's where I think, like, if you had to pinpoint the root of addiction, it's the lack of balance. So the lack
Right.
of balance in self-esteem when you're growing up, the lack of balance in consequence and reward, all of this coalesces, and you start trying to inject balance into it in ways that are maybe quicker and easier, or sometimes it's just that's the only way you
And
know.
for me personally, I was always that type of person that needed instant gratification with everything, everything.
Right. Right.
Like
Yeah.
an instant gratification seeker. Like if it like it has to be my way. Oh, and a control freak. I'm a control freak. I now in my recovery want everything under my control. Like things have to operate a certain way for my mental health. Like for my mental health to be okay, I have to do certain things and I have to always constantly pour into my mental health. It's something that I work very hard on. I do regular therapy and EMDR therapy on a weekly basis. For the past 9.5 years, I've been doing therapy.
Wow. Man, that is awesome. I had a weird road for myself. So I've been to therapists and talked to them. I don't have anything against it, but I am so, believe it or not, introverted, that I get more out of self exploration. And I've not, until this point, I've not found a professional that would guide me in that direction,
That
you
makes
know?
sense. A lot of people struggle to find somebody that they feel is going to validate their
Mhm.
feelings, that they're going to connect with, and that they're going to be able to open up to.
And I grew up so fiercely independent, and we could get into that on another podcast, but I grew up so fiercely independent. I feel like I have to solve the problem. So a lot of my time is spent reading books that provide that introspection, that trigger a thought process that I otherwise wouldn't have had. And it helps me discover things. And I only bring it up because I feel like there are other addicts who therapy's fallen short, and maybe it's because their brain just works that way. Like we were talking about, you need a tailored experience. These problems with addiction, they're as dynamic and different as we are. because I mean, it only makes sense that they would be, you know.
Right. Everyone has different trauma. Everyone came from different family dynamics.
Hmm.
Everyone, so it's like you can't treat it all the same.
Mm-mm.
Everyone has to be looked at individual.
Yeah, and to me it seems strange that medicine has not really approached it that way from the beginning, given that we know that you and I can both walk in the same office for high blood pressure, and what works for me might not work for you.
Right.
It's amazing. Like if you and I were to deploy to Africa right now together, right? You are of Mediterranean descent and I am not. I can take Primaquine to prevent malaria. It'll give you hemolytic anemia, or it could give you hemolytic anemia, kill you, and shut your kidneys down. We know that we're different, and we've known
Right.
this from the beginning. It doesn't make any sense that we wouldn't be different from the neck up. That would actually be the odd thing. If everything from here up worked the same, that would be the real amazing thing. So
Right.
it seems almost intuitive that we should have been approaching it from this vantage point from the beginning, and yet we haven't. And I really wanted to do that. That was kind of the goal of this episode, was to sort of put a very human face and experience on this.
And
And
I was in my active addiction for 23 years, guys.
wow.
I always get that you don't look like an addict. I just had this comment on my TikTok. Somebody said, if I was to look at you, I would never know that that was in your past. And I want people to see me and see my face and know that there's brokenness that lies within everyone. There's
Hmm.
pieces that I'm still putting back together, but you can change your life. You can get up and put one foot in front of the other. It's possible.
That is a beautiful way of looking at it. That if people can look at you and say, I never would have known that was in your past, that can give people things to aspire to.
Right.
Because there's a lot of, and I want to talk about a gritty thing for a minute. When we see people that have been through addiction, when they're in the throes of addiction, they look in the mirror and they say, I've got problems with my skin now. My hair is thin. I've lost some teeth.
I've
All
been
these
through
things
that.
that have you?
So I
Yeah.
want to be open. I want to be very open and honest right here.
Okay.
So when you look at me, you might see somebody that might look put together. My teeth are fake, all
Okay.
fake. I lost all my teeth by the age of 25. All
Oh,
of them
wow.
gone. Boom.
Wow.
That is so my teeth issues stem from my addiction, not taking care of myself, not doing self-care. I didn't care. But the other thing is I have a lot of GI issues. So I
Mhm.
have a lot, like I'm very acidic, and my teeth, like my enamel on my teeth just started rotting
Right. Right.
from from all of the acid coming up from my stomach too, they
Hmm.
said.
Well, you know what? That's an absolutely wonderful thing for you to share, because people are very self-conscious about their teeth and their skin, right?
Right.
And they may look at themselves in the mirror if they're in a bad place and they're listening to this. I hope they're listening. And they could look at you and say, hey, she is absolutely gorgeous. I never would have known she had any problem with addiction. That's what's on the other side of this for you. If you're going through this right now, I want you to know that you can have that too. It's not easy. It's just totally worth it. And it takes, like Marie has really illustrated, uh, getting rid or dealing with that underlying problem that sort of led you down here. Now you have to deal with that and everything else on top of it. But how do you eat elephant? You know what I mean?
Right.
One bite at a time. It's not a mountain that's too big to climb. And on the other side, that
No.
reward is so great.
Right. And this is the thing. I want people to know this also. You can do hard things in recovery. Remember that. You can still do and make hard decisions. I recently left my kid's father. I was with him for 18 years. It I got to the point where I was already emotionally detached for years, but he was having a very difficult time letting go. And it just got to the point. But now here I am, a single mother of 4 kids. I'm off of medicated assisted treatment now. I got myself off of the Suboxone. That was my own personal choice because I went on my Sublocade journey. For those of you that might not know what Sublocade is, it's another form of medicated assisted treatment, just like methadone and Suboxone. It's pretty much Subutex in an
Okay.
injectable form. So it doesn't have the naloxone in it. but they put it counterclockwise around your abdomen in an injectable form. And I got 5 shots and in 168 days walked away from 8 years worth of medicated assisted treatment.
Wow. That's a success story, man.
And I want you to know my life isn't all rainbows and butterflies. It's not. I have a lot of stressors in my life right now. I'm going through a lot of court situations with my kid's father that are extremely stressful. I have 4 kids that all have individual needs. Like my kids have 3 of them have ADHD, 2 of them have a genetic diagnosis. There's different individual needs within my household, but I try to make sure that I prioritize mental health for everyone because it's so important. Because I think if we don't prioritize mental health from a young age, that's how these issues occur.
And I think it's good that you share how much stress you have, because the big takeaway from that should be that you can handle a very complicated and tough life without this stuff. It's just not as simple as just getting it out of your system, but you can have you back. You know what I mean? These people can have themselves back. And I want them to know that, and I wanted them to see you.
Oh, it paused for a second, right?
Oh, did it? Yeah, it must
I
be.
didn't hear what you said. I don't know if you paused either.
Oh, no, I didn't hit anything. It's probably just an internet thing. But no, what I wanted to tell people is you can have yourself back, and you can handle extremely stressful life situations without this stuff. It's a process. It takes a little while, but especially when people are addicted, they get tired of having to manage their addiction by planning ahead for it. Do I have enough to take this trip? Do I have enough to get through the day? Will it last till the end of the month? Can I go do
That's
that?
one.
You can get rid of that.
That for me was one of the reasons why I wanted to get off of my Suboxone, because I just wanted that freedom of not having to play with the pharmacy anymore. The pharmacy was starting to give me problems when I would pick it up. And I wanted the freedom of knowing, like, if I need to leave today to go out of state, I could go without having to worry about a prescription.
Right.
Hold on, I've had surgeries while I've been medicated assisted treatment free. I just had a revision surgery on my breast augmentation. I had revision lipo and dog ear removal on my hips. I was able to do that pretty much medication free.
Awesome.
I took the pain medication when I needed it, but I also had that control to put it down when I knew that I didn't need it.
You know what? Because it's relevant. After your surgeries and things, do you feel more positive about what you see in the mirror? Do you feel more positive about your body now? Do you feel confident?
Honestly, surgery doesn't make you more confident. I'm going to be 1,000% honest about that. My issues are all up here. There are things that I'm working on in therapy. What I see in the mirror is totally different than, it's just, there's a distortion there. Like, I pick myself apart. I'm still not 1,000% happy with what I see. I kind of fell off the bandwagon of working out so much, but I have been back to my daily walks. I'm trying to get myself back in that very positive mental headspace of working out, because that's when I really felt the best mentally.
Well, and I think it's important to highlight that for the people listening is it is very common for you not to see your own body the way your mate would see it, right? It's very common for a man to look at a woman and think she's drop dead gorgeous, and for her not to see herself that way.
I really think for me, it really stems to the cheating. It's just, it makes you feel like, what's wrong with me that somebody has to go somewhere else? That's what it is. Like, and I'm sorry, but like, my trust is broken right now. Like, I got to work on that. I just feel like I'm still in that healing. I'm on a very intense healing journey right now. I'm really working hard in EMDR therapy to try to figure out, it kind of removes some of those memories, the EMDR therapy, but also my anxiety kind of increased because I'm bringing a lot of that home with me subconsciously. I've been waking up having like panic attacks, feeling like I can't breathe. That all started when I started the EMDR therapy more intensely.
Hmm.
So
I,
I'm trying to figure
okay.
out, I'm learning how to cope with certain traumas.
You know what? I get that. And I think it's good for people to hear that and know that they're not alone. If you've put all this time and effort into yourself, your body, your image, whatever,
And I still
and
struggle.
yeah, and you still struggle, then
Right.
that's the norm. That's not the exception. That's the rule. You know, I get that. And I want people to also understand that it's not just for people who are single or trying to date or whatever. You can be married 20 years and each of you sees the other one as sexually attractive or beautiful or whatever, and you not see yourself that way. That is normal in terms of we all go through it, but it is also something you can help yourself with through therapy and different measures where you can
Right.
finally see yourself as valuable as you are, because you can remove that societal lens you put on yourself and those unrealistic expectations you had for
Well, can
yourself.
we talk about perfection for a second?
Hell yeah, we can't go for it.
Okay. So I feel like growing up, my family was very big on perfection.
Hmm.
Everything had to be perfect. Everything had to look perfect from the outside. And I think that that set me up for failure
Yeah.
because for everything to always have to be perfect is very unrealistic. And
Yes.
that's why I feel like I went down a lot of the roads I did because there's an inner voice in my head that searches for perfection in everything.
Right. And it's impossible. It's
Right.
impossible. If I had this conversation with Mrs. Carr the other day because I was coming out of the shower, I was walking around without a shirt on, and I'm super self-conscious. You'll never see me do that at a swimming pool or anything, but just around her, and we've been married 17 years. Well, been married 15, been together 17 years. Around her, I'll do that, right?
Right.
And she said, you are jacked, like you are getting jacked. And I remember it just kind of, it was like a punch in the stomach. You know what I mean? Like it sounds like a statement of ego, but it's not. And I remember thinking to myself, I wish I could see me the way she sees me, because
Right.
here's one of the things about it, and this is a type of addiction. If you're waiting to see yourself change into that perfect thing, let me save you some trouble. It will never happen.
You're right. It's gonna
If I could see, if 20 years ago, I could see a picture of myself today, I might think, man, I'm doing good for myself. But to watch it happen every day, I don't feel that way. And I'm never going to feel perfect like that. I'm never going to feel like I look like the magazines I read growing up. Right.
also social media skews our
Yes.
views on perfection.
Hmm.
And that's the issue with like our children growing up. They see everything perfect. Like here's an example. My kids like to watch a lot of YouTube, okay?
Hmm.
These YouTube families get stuff donated to them around Christmas time to, toy companies, sponsorships. My kids think that's what Santa brings.
Right. Right.
Uh, that's not accurate because
Yeah.
they're literally doing this for a video.
Right. Right.
And they're showing the perception that like you're not good if Santa doesn't bring you all these things. You're not a good.
Right. Yes.
I don't like that.
So
I have
that's
an issue with
huge.
that.
You know what? I do too. And that is actually kind of how I think you and I hit it off, and Kyle as well, because yeah, I got into the social media space by accident. I actually disconnected from all of that stuff a couple of years before the TikTok thing came about. The only social media I would participate in was educational videos, and for the first few years, I didn't show my face. Um, when I got ready to do it, I said, it's going to be gritty and imperfect because that's real. I want
Right.
it.
You want to show raw and real.
Right. I feel like in this world full of just fake everything, people want gritty reality. And I think that's good for them. And
Right.
I think that's why Shade Tree Cardiology has been successful. And I think that's why Pod Talks and the stuff that you and Kyle do, I think that's why you guys continue to be successful in helping people, because it's realistic. And when you set something, a realistic example, people can follow that, and then they can feel that achievement because it's real.
Right.
you know?
It's obtainable to them.
Right. Because it's real life. That's the only
Right.
reason it's obtainable is because it's real life.
But
But
when something's so perfect and like everything looks perfect on in the videos and all that, that's not real.
I think we
It
hung
skews reality.
not exactly. I think that's broad scale, and people may take issue with the examples I'm about to use, but broad scale, people hunger for reality now. And and
Right.
and they've been lied to about what reality was with reality TV and these things. I think that's why even in the entertainment industry, right? We're seeing people move sort of away from films and movies and more into podcasts and home videos. And even in the adult entertainment market, you see people moving away from these heavily curated things and more towards people with private accounts on things like
Right. With like
OnlyFans.
raw and real.
Right.
People want raw.
People want real life, and they've been deprived of it for 20, 30, 40 years through media stuff. That's one of the reasons I think people like podcasts, because it's a long 3 hour conversation. It's not a 6 minute video on addiction from Tony Robbins, which not to poop on Tony Robbins, but this is
Can I
real, you know.
can I also point out one thing that just came into my mind
Go for it. Yeah.
about the instant gratification? I think that a lot of people love TikTok because it is instant, it's quick,
Dopamine.
instant scrolling,
Yeah.
instant gratification. You can really like become addicted
Mm-hmm.
like to scrolling. Watch in a few years, they're gonna have like a scrolling finger like issue.
Yeah. Oh yeah, yeah. Like we saw the carpal tunnel
Yeah,
with the
right.
texters.
Like what we
Yeah.
saw with the selfies, like because a lot of people they don't want to watch longevity. They want that quickness.
You know what they do, but I'm also seeing that change even in the realm of TikTok. And I don't know if you guys have hit the point yet, but you'll hit a point when you get a certain number of followers where you get to opt into the beta program, where you only get paid if your videos are over 1 minute long, and you get to post stuff up to 10 minutes. So it promotes long form content. And in my
I
mind,
tried that and my videos weren't getting shown.
yeah,
And I got out of
it's
it.
weird.
The day I got out of it, I had one video that went to like 18,000 views in one day. It was weird.
I lost a ton of the income. I went from making a few $100s a month to like 38 or $40 a month. But for what I was trying to do, it was better for me to stay with it, because that 10-minute option gives me the ability to sort of elucidate complex medical concepts. And for the few people that watch it all the way through, that's what they're there for. And they're who I'm
Right.
here for. You know, I'm
Yes.
here for them.
You know
So
what it is? The
it's,
right people will find you.
yeah.
Your tribe and your people on TikTok, they find you.
Mm-hmm.
Just like in the recovery community, I tell people when you're looking at somebody, you want to look at them and be like, I want what they have.
Right.
Like you want somebody that has all what you have, not just some things.
Mm-hmm.
Some people look at the wrong people. There are wrong
Yeah.
people with wrong intentions.
Mm-hmm.
Remember that.
Oh,
You
yeah.
have to really listen and get to know the people that you want to reach out and ask help from.
Right. And well, and as leaders, and you are definitely a leader in your community, and I think I'm one in mine, but as leaders,
You are.
it's up to us to be someone that is worthy of their aspirations, to be some, when they say I want to be like them, it's our responsibility to be a respectable character version of a human being that they can aspire to. So realistically achievable, but willing to admit your mistakes and move
Right.
forward. You know, that is just crucial. And I think that's why TikTok has built this whole infrastructure that pays you differently for longer videos. People are they're moving towards it. I think in our own weird way, societally, we have grown tired of our instant dopamine quick scroll addiction, right? And we want long form content now. And I think that is growing, and I think it's a good thing. I think it would be a great day when three presidential candidates get on a 4 hour podcast instead of having 30 minutes or 30 seconds to sum up a complex geopolitical issue. You know, because
Right.
that's where we're at now, right? It's got to fit in a sound bite, and your debate 2 minutes. How are you going to fix the Middle East in 2 minutes? Bro, you bring me a guy that can explain how you're going to fix the Middle East in 2 minutes. We should make them president of the world.
You're right. You're
Nobody's
right.
that smart. You know, no issue is that simple. So I think we're getting there, and I'm happy to be a part of it. I'm like that guy in the corner of the room smiling. I'm just happy to be here, man. I'm just jazzed to be a part of it. And I am just, thrilled to be able to talk to people like you and help put your message out there. And I learned a lot today. My own individual addiction experience was more, toward the alcohol thing, which is just, that's the road, that I walked. And I found so much in common with you listening to you talk today, but I also learned so much that even with the introspection I've tried to put in, I didn't think of or fully consider. And I wanted to cry with you so bad, so many times. So if this had
Oh,
been in person, I'd have been bawling with you. I just so you know,
well, I
it's just
appreciate
amazing.
it. It's like it's good to find different people that you could connect with and try to reach out to help others with a message.
Yeah.
And there are times where I really wish that my message would get pushed out there more because I want people to know that there are so many options to recover today. It's not AA, it's not NA for everyone. When
Hmm.
I was first started recovery, I felt like I had to fit into a box. I'm a circle. I don't fit into a box.
I
Like it
dig
ain't
it.
happening.
I love that.
I'm
I
not
dig it.
I'm not that person. Like I don't fit into the norm. And
Right.
I did. I felt like I belonged with those people, but I still felt different. And their way to recover was just different. I found my own way. You can find your own way as well. Medicated assisted treatment, therapy, Sublocade. I have a Sublocade support group. I try to help people that might want to get off of these meds.
Oh, you know what? And I'm glad you brought that up again. I was going to remind you, or not remind you, but I was going to tell you that I'm going to put all that in the details of this video on YouTube as well, so people can find it. And I'll
Okay.
probably share this on Facebook, and I'd like to include those links. So I know you texted me some stuff earlier. If you want to text or email me pretty much everything you want to steer people towards, I'll put all that in the description and stuff of this video, so we can help people. And then, since recovery is a continuing process, do you think you might be willing to come on again periodically and just kind of share more of everything with us and how it's going so people can draw inspiration from that?
Absolutely.
Awesome.
Absolutely. Because you know what? You're right. Recovery it's always evolving. I'm always changing, learning, growing, doing new things. And I would like to share how I'm managing without meds.
Hmm.
Like
I
how am I doing being a single mom without feeling like yesterday I was on Pod Talks. We were doing the podcast. My kids would not allow me to have that hour. They were not having it. I literally just got off because I had no choice. But you
Mhm.
know what? I'm mom first
Right.
because I worked hard to get my kids back.
And it's
Like,
it's
you
it's
know,
awesome that you can watch someone deal with those dynamic situations without having to go to the substances, and you can draw strength and inspiration from that. You know
right.
what I mean?
And that's what I'm trying to do. There are so many people that reach out to me that are on methadone, that are on Suboxone, that are saying, like, I think I might be ready. You know, a lot of people that are on methadone do not know that you can use Sublocade
Hmm.
or Brixadi to titrate off and come off, pretty much
That
withdrawal free.
which is a great
And my
thing.
Sublocade group, I have people that have been successful going from methadone to Sublocade to nothing.
That's awesome. That's awesome.
It
Keep
is.
keep doing
It's
it,
awesome
man.
because this is my saying, and I tried to pitch this to Sublocade. Suboxone gave me my freedom. No, Suboxone gave me my Suboxone gave me my life back, but Sublocade gave me my freedom.
Oh man, that's powerful. That's
Because Suboxone did give me my life back. But the Sublocade journey I went on cut the ties. I walked away from meds.
that's huge, man. And I
And
think
today
so
I
many
feel
people want
free.
that. You know,
Right,
they
right.
they want
But
their
you know
life
what?
back.
If people need to stay on MAP meds, I fully support that as well because you are living your life. You're living a beautiful life. You're working on your recovery, and that's all that matters.
Whatever breaks those chemical chains, whether
Right.
it's a maintenance dose that allows you to live the next 30 years without having the episodes or without it taking over your life, whatever it takes, to do that. I want people to have that. And I want people to know that if they come here, if they comment on this video, it's a judgment free zone. I will probably curate the comments on this one, especially. So any of the detractors and naysayers, I'm probably just going to delete all their stuff, because
You
when
know what? That's
people watch this,
okay
they're
though.
looking for
I'm
an answer.
okay. I have a tougher skin to know that those comments happen.
Well,
Like
and
when
I
I
get
first,
that, but I'm more worried about people who are early in their journey reading that stuff and how it
right.
might permeate their consciousness. You know what I mean?
You
It would
know,
be a shame.
if you're early, if you're early in your journey and you need additional support, my inbox is always open. I respond to messages. I do answer people back. I try to help guide people. I've been a support person for people. Like there's been people that are like, can I just have your phone number so I could check in with you on a daily basis because I don't trust myself right now. Can I just send you a text like I'm good today? I'm not. Yeah,
Oh man,
absolutely. That's
that
what
is
I
excellent.
put myself out there to do. Because you know what? Especially mothers that are struggling. My heart really goes out to mothers struggling. I've been pregnant and homeless. I've I've been to places in my life that I never thought I'd be in, ever. But I've gotten myself out of those situations as well.
You know, that might be a great, and I don't know if you're already doing this, but that might be like a great business venture. And I know that sounds like I'm trying to monetize it, but it's different. Like for example, everything I do for Shade Tree Cardiology that's profitable, I turn that around and put it back into Shade Tree Cardiology, so I can spend more time reaching more people and being an educator and providing the service that is unique to me, and greatly multiplying the good in the world in what I'm best suited for. And
I
you
would
know,
love to do that.
sober coaching, yeah, you might
I
be
don't,
fantastic.
I would love to do it. I just got to figure out how to do it.
You know what? That it was the same thing for me, but I'll tell you this: don't be afraid to invent something. Don't be afraid to just invent it. Like we talked earlier, technology, right? I'm not
Right.
super technologically inclined, believe it or not.
Oh,
My guys offshore, because everything's remote, they kind of make fun of me because I have to learn stuff. But I just immersed myself in it and Googled and broke things and did things wrong until I got it right. And there's a friend of mine, his name is CJ Ortiz. He does a lot of motivational stuff. He's got this great saying, and I want to put it out for the world. Go check him out, CJ Ortiz. He says, "Don't be afraid to suck at something. You know, don't be afraid to do something new and be bad at it at first, because you will get good. You know, if you keep headbutting a brick wall, it will give. You know,
I
and
always say this, not practice makes perfect,
mhm,
but practice makes permanent. Because
yeah,
once you practice something, you like permanently know it and understand it. It's never going to be perfect, but you're always going to know it.
yeah. I have one similar, and I love like little axioms and mantras. I love those. But I have two that I live by. One is similar to what you're saying. It's progress, not perfection. So I just always want to be
Right.
making progress, because perfection, as we discussed, it's impossible. And the other one, and this is something I want the whole world to hear: difficulty is the measure between effort perceived and effort expended. So how difficult did you plan for something to be? That has a greater amount of influence on how hard you think something was. So for example, if I go to work on my car and I'm just going to change the oil, right? That's a 30-minute job. If I'm done in 5 minutes, I think, that was easy. But if it takes me all day because I rounded a boulder, I screwed something up, I say, oh man, that was hard. So when you approach difficult tasks, be it recovery or learning a new skill, plan for things to be absolutely atrocious, like full permission to overthink this one. This is the only time in your life overthinking is going to help you, right? Plan for it to be the apocalypse, because then no matter what gets thrown at you, you don't lose determination, you know?
I got an example of that one real quick. So
Let's have it.
recently
Yeah.
when I had my last surgery, my kid's father would not watch the kids for me.
Oh no.
So I already had my plane ticket bought. I had to leave the state. I had to go from Massachusetts to North Carolina.
Really? North
So
Carolina?
I lost, right. I lost my money on the plane ticket. I said, whatever. My anxiety about thinking about bringing 4 children with me to have surgery and driving. First of all, I don't like long trips, period. I don't like to, can't take my kids to Walmart sometimes.
Hey, in
Like,
your
let's
defense,
be
man,
honest.
taking
Like,
kids to Walmart can be tough. That's
listen, right. I can't even take them to Walmart half the time. So I knew that I had to have this surgery done. My surgery was paid for, the Airbnb was paid for. Literally, the stress of knowing that I had to bring 4 children and take that. First of all, they were out of school the week prior. I had to take them out of school the following week. So have them home for 2 weeks off of school,
mm,
have surgery, and then drive back recovering from surgery by myself. I was so scared to get in the car with them. I almost didn't think it was going to happen.
oh wow,
The amount of intrusive thoughts that were going through my head were crazy.
I
The
get it.
bridges, the tunnels, driving through New York traffic, all of it.
Yeah,
That's why I know to do hard things in recovery, because guess what? I didn't have a choice. I had nobody that could help me. I had to put my kids in the car and I had to figure it out. I did. And guess what? That's one of my proudest mom moments right now, is knowing that I made it and I did one of my biggest fears, which was to get those kids in the car and take them on a trip by myself like that. But I did it.
powerful. That is so
And
powerful, man.
now I know that I could do hard things. Like, I'm coming out of a toxic relationship, and I realize now that a lot of the feelings of feeling held down and like I couldn't do certain things came from my relationship being like that.
Hmm. That
Like,
is, you're spreading your
I,
wings. Yeah.
right. So, like, now I'm realizing, like, my kid's father, he always didn't have a filter on his mouth, and he'd be very embarrassing, like when I would go out in public with him, like in a store.
Oh
So
no.
I would stop going in a store.
Mm.
So I would sit in the car. Then I would just not even get in the car to go to the store. So it became almost like a form of self isolation
Oh, that's
over the
terrible.
years.
That's terrible, man.
Then now I'm realizing that, like, I isolated myself because of someone else a lot of the time. Now I'm feeling confident putting my feet back out there and knowing, like, since I did that one trip to North Carolina and back, I've already taken my kids on a beach trip to Connecticut, like, spur of
Nice.
the moment, like, because you can do hard things. You can.
And they get easier the more you do them.
Right.
And
Right.
yeah.
And that time when I went to the beach, my kids were like, Mom, you're going over the bridge. You're not even freaking out. Oh my God. And they're like cheering me on in the car. And I'm like, yes, yes,
That is
because
awesome.
I was proud of myself. I was proud of myself for once, for saying, you know what? Getting all the kids in the car is difficult. It's hard, but it's my life right now. And I
Right.
want them to have a good life. I want to make memories. I want to get out of my shell a little bit more
Right.
than how I've been past years.
You know what? I
And I'm
think
finding that more and more.
that might be one of the most powerful moments of this podcast, because it gives people a right to spread their wings too. And I will tell you this: the next time you're in North Carolina, Mrs. Carr and I would love to have you over. And because you said your parents were Italian, I got to tell you this: I make homemade marinara, and I mean, when I say I make it, I mean I start with a bag of Roma tomatoes. And
Ooh.
my doctor is a Sicilian from South Philly, and he approves. Doctor, his name is Doctor Ricci. Like, I speak Italian to him, and I don't want other people to hear what I'm saying. Like, he's hardcore, and he approved. Matter of fact, we call it gravy, if that tells you
I
anything. So,
call it gravy.
right,
That
it's
is
real
gravy.
marinara.
A
It's
lot.
gravy. Yeah, it's
Listen,
gravy.
a lot of people will argue with me over that. Like, it's an argument whether it's sauce or gravy. I've always called it gravy. I don't know. I'm from South Jersey, Italian.
Yep.
My parents always called it gravy,
If it's
like Sunday
homemade,
gravy.
it's gravy. If you dip a mozzarella stick
Right.
in and it came out of a jar, it's marinara. But if it's homemade, it's
We never
gravy.
use jars, nothing. We've always, yeah, we always make our own.
His wife actually got mad at me when I made it, because he goes, she just feeds me stuff out of jars. You should meet this guy. He's hilarious. But
Uh-oh.
he's the greatest doctor on planet Earth. When I grow up, I want to be just like him. He's a super straight shooter. Um, tall guy. He doesn't wear scrubs. He wears he wears a scrub top or a Carhartt shirt. He walks around. He's got his cigar in. He doesn't smoke them. He just chews them. Like, tough kid from South Philly,
Like a
self-made
straight
man.
shooter, like
Yeah,
he's giving it to
he's
you
a
later.
He's a self-made man. He like got his first job as, I think he was like a soda jerk when the pharmacies had those. And then
Wow.
then the pharmacist started letting him help out in the back. So then he works his way through pharmacy school because he wants to do that. Then he does that for a few years and he goes, you know what? I think I'm going to go be a doctor. And to get his loans paid off, he worked in rural North Carolina and he liked it so much he just stayed. He's awesome. I could sing his
I
praises
always
to high
wanted to
heaven.
get into medicine myself. That's one of my biggest regrets because years ago, I was going to school for like nursing. Like, that's what I
Mhm.
wanted to do. And my life just took me in a different direction. And I've always had a love for helping people, for medicine. Like, I really, truly am infatuated with medicine and what certain things can do. So I love what you do.
Well, look,
I
man,
do. And I love how you educate people.
well, thank you. And it's never too late. That's why they invented death. So if you want some guidance toward that, or you want some help, or you have some questions, I have made my living teaching
You
people
know
and I
what
would be happy
makes
to
me
help.
nervous? My record.
You know
I
what?
got it.
There's lots
I
of
got
people.
charges for calling in prescriptions. Like, how could I be working in the medical?
It would depend on, which capacity and how long ago they were and stuff, but you would not be the only
Right.
person with a record in this field. We call ourselves bleeding healers because a lot of us have a past.
I
And
love that.
and we are, and a lot of times we end up hurting ourselves because we think if we fix enough of other people's problems, it helps us, and that messes us up a lot because we don't do self-care, which is, another problem I'm trying to tackle in this field. Matter of fact, my whole book is on, I just released it 2 days ago. It's on that thing and how we treat each other and how our
I need
own
to read your book. I
I'll send you
definitely
a
need to
copy.
read your book.
I'll send you a
I
copy.
I absolutely love, the fact that how you want to reach people and help people because you have the same thing that I have, that thing inside of you where it fills your cup to help others, right?
Right, right. It's there's so much bad in the world that I want to try to undo some of it, but I haven't shifted away from medicine. Obviously, that's still how I make my living, but I see how we hurt each other in the medical field, and I think a lot of that contributes to how we hurt our patients emotionally and things. And I think that a lot of it's unresolved trauma. And so I wrote a book called We're Doing It Wrong. And that's what it really focuses on, is how we treat each other. I think it's something anybody could enjoy. It's not like a book on chemistry and EKGs like the last one. It's a book on how we should be better to each other.
I love that
I'll send you a
because
copy, man.
that's something that I really try to practice on a daily basis. I think self-care is extremely important
Yep.
for your mental health. When you start letting yourself go, and that's why I'm so big on self-care now. I'm huge on self-care now.
Mm-hmm. I
Sometimes
am I
it's
am now. Yeah. I let it
right.
fester to the point that it got so terrible I couldn't take care of me anymore. You know.
That's what I'm saying. And when you lose yourself to the point where you don't even want to look in the mirror and your face is caving in because your teeth are missing and you're 90 pounds wet and you just look rough, you can change all that. A
Mhm.
little self-love goes a long way.
Yep.
You just have to start though. You have
It's
to start. Make a date with yourself. I always say that.
it's got to be real too. You got to feel it, right? You got
Right.
to. For me, and this is what's crazy, because I have a lot of people that they like me, or they think, man, I wish I had your brain. It's like, no, you don't. It's hell in here. My first step was I just had to become comfortable in my own skin. I had to be okay with being me. I hated everything about myself. I had this neat little veneer that I represented, and I let people see what I wanted them to see. And I was
Right.
able to inspire. And I always kind of thought that this is how it was. I'll put good out into the world, but I'll suffer internally because that's just how I'm built. And it doesn't have to be that way. And what made it even better is I was able to accomplish 3 times as much in my mission to put good out there and help people by taking a few minutes to declare a truce with myself. And it started out as a ceasefire, right? So
Right.
that voice in my head that hits me with this negative stuff, that's like, you know what, you screw this up every time. You knew you were going to do it again. I don't know what you were thinking. That
I have a
guy, I
question.
got him to get quiet.
Is
Mhm.
the voice in your head your voice or is it
No.
because sometimes the voice in my head is my father's voice.
Yeah, it's my father's voice.
Right. I have the same
Yeah.
thing.
I love my dad, but he was very harsh when we were growing up. Like I can remember him and I actually put that in the book is, he used to tell me everything you touch turns to shit, and it was a fit of
I
anger.
know.
He was
I can
throwing a
relate to
tantrum,
you. I think it's the way that they were raised. It
yeah.
really is. It's like,
Yeah, generational trauma
right.
is a
And that's
huge
why your
part.
book is going to help so many people to understand that trauma is really the root of suffering.
Hmm. And I can tell you, if you ever get the urge to put pen to paper, the story I heard today, I would love to see it written out and a book for people to read. If you ever get the urge to do that, I'll show you everything I do. I'll show you how to publish it on Kindle because I remember you're not super into technology. It's easier than you think. I will help you step
I
by
would
step.
love, I would love to do something because honestly, like right now, I'm trying to figure out another way for me to be able to support my family. It's
It's great.
hard. It's
It's liberating to put pen to paper and to tell your story. And I'll do the whole thing for one autograph copy. That's my fee. You got to sign it and
I
send me a
love
copy.
that. I
But
love that. I can't wait to
no,
read your book though, seriously, because that's what I'm working on right now. Like you hit the nail on the head.
you know what? I would love honest feedback because it's a first edition because I want to update it and change it because our society is constantly changing. So I published it as
I
an
love
edition.
that.
And so any feedback you have, I'd love to have it. And thank you so much for being on
Thank
today.
you.
It's
I
such a
feel
wonderful
honored to
story.
come on today. When you reached out to me, I really felt honored. I did. Thank
Thank
you.
you. Thank you. It's such a big deal to have people share a story of success and recovery and it's wonderful. I was, a lot of people dress up their story and they try to make it rainbows and unicorns and you didn't do that. You gave people a real picture that is something they can not only aspire to, but they can achieve. And that is so important and is so much better than a lot of the curated garbage that's out there in terms of addiction recovery. So I am
I just
honored that you put yourself through this because I know it was emotional.
I just want people to know this is what I tell myself. I really think I actually might get this tattooed. You can do hard things.
I love
Like
that.
I tell
I love that.
myself that 1,000 times a day. That's become my mantra, especially since I'm a single mom now.
Hmm.
Like I wasn't the one, like I'm very introverted. So a lot of times I tell dad to go to the grocery store for me.
Hmm.
Now, if my kids want to eat, who has to go to the grocery store? The introvert.
Right. You know what? I get that. I have something
Hey,
similar.
hold on.
Oh,
This
sure,
is
sure.
me, the introvert that wears
Yeah.
the sunglasses all day. You know why I wear sunglasses all the time?
What?
It makes me feel protected. It makes me feel like nobody can really see me.
Children do that. That's
It's
a
a
not in
form.
a bad. I
So,
don't mean that in a bad way. I mean it in a good way.
no. So, like this right here, like the weight of the glasses, the way they sit on my face, like there's like a sense of security that comes on.
You know what? I've said this before, and it's amazing because I never thought I'd have this thought again. But at one time I said we trade in our blankie for sunglasses. You know what I mean?
Wow.
It's a security.
Wow.
Yeah.
Oh my God. You just really had me have a light bulb moment.
Today years old, right? Yeah, I'm gonna have to edit all this. Oh yeah, yeah, I'll edit that. I have those people too that but a matter of fact, I got it going on here right now, so my wife could break in if she needed to because she's my filter for the rest of the world. What was it? She was like, "Do you have your phone?" I said, "No. Anybody who knows me well enough to need me can call your phone." I was just like, "I'll leave my
Right.
phone."
Right. If you're not available, he's next you.
Yeah, 100%. Well, look,
I love that. But
I
you know
better
what? That's
take.
teamwork.
Uh-huh.
Teamwork makes the dream work, right?
It is, man. We are well. It's so we've always said me and you against the world.
I love it.
That's our thing because nobody's coming to save us, right? We got to figure it out. And of course, it's we've had times where it was me and her against me and her because I think every marriage when you cohabitate with another human being, there's always like a steep learning curve there, because you're gonna give people permission to hurt you. You're gonna tell them things about you. You're gonna open your coat. You're gonna let them see the knives hanging out of you in the hopes that they don't twist them. That's what trust is, right? So
Hmm.
we have overcome all of it, you know, and so far, and tomorrow we'll throw new challenges. But at the end of the day, I'm really happy that I have one person on planet Earth who knows every bad thing about me and still loves me. And that's a
I
big
love that.
deal, you know. Well, especially the internet, right? The internet gives you kind of a false sense of security if you let it with, you know, people see this and they, you know, I go to these conferences, people shake my hand or they hug me, and that can make you feel unduly good about yourself, right? And you can feel like an imposter because you know, you think these people only see the best parts of me. But I know that, you know, there's one person in this world who knows every bad thing about me and they still love me. And I draw a great deal of strength from that. You know what I mean?
I love that. And that's why I think it's important, especially with social media, that we
Mm-hmm.
don't make things look like rainbows and butterflies. I went through a very difficult time in my life. I lost my kids twice. The
Mm-hmm.
amount of emotional pain that that caused me caused a lot of other secondary issues for me.
Right. Right.
Like that caused me problems bonding, you
Mm-hmm.
know, like I've had issues bonding with my kids after they've been removed from me. I've
Mm-hmm.
had issues over bonding with my kids. I've had issues over buying them things, overcompensating, all of
Right.
it.
But it's like you said, you know, I can do hard things, right? You know, you
Right.
push. I have a similar one. It says, "I will not be defeated," and that's when I'm at my wit's end. I kind of stand there and I straighten my shoulders and I say, "I will not be defeated." You
And
know,
the other thing is, my children know that I am in recovery. I am very vocal about my recovery period. They watch me make videos,
mm-hmm,
they hear me talk because I want them to know that
mm-hmm,
I struggle and that if you're having struggles, you could come to me. I understand those struggles. I'm vocal about a lot of it because like my daughter told me yesterday, I'm so happy that my mom knows a lot about recovery because I could always talk to you about it. And I was like,
mm-hmm.
wow, that was an
Wow,
8-year-old that told me that. And I'm like, wow.
they're
But because
smarter than we give them credit for. You know.
right. And they listen to more than you think.
Mm-hmm.
They listen more and take in a lot. And I want my kids to know mommy had a fight to get to where she's at.
Right.
It wasn't handed to me. The things that I had today, the reason why I freak out, and I'm so like, I want my car has to stay a certain way. It has to stay perfectly clean
Right.
because that is my one space that is
Right.
mine.
Right.
No,
You got to
like
have that
I don't want,
control.
right. I don't want them bringing their toys and stuff into the car, this and that, because I worked so hard to get my license back, to be able to get a car, to be able
Mm-hmm.
to when the state had my license for that medical hold, that was so hard for me to get back. It was
Mm-hmm.
almost impossible.
No, I get that, and you know, when it's kind of that classic thing, like the harder you work for something, the more you cherish it, the more you take care of it.
Right.
You know, the difference between the spoiled kid and the kid who had to save his money from a paper route or whatever, you know, and get these things. You can tell who you can tell how hard something is worked for by how it's maintained a lot of times, because easy come, easy go, you know.
Right.
That's one of those things where I'm very protective over what I built, you know, and I don't squander it. I don't, you know, just I'm not willy-nilly with this life that I have, you know, because it wasn't handed to me and I had to reclaim it at some point, through a lot of demons, you know, that I've had to
Right.
fight. And like my peace is a great example. I do not readily give people my peace, you know, and that's, so everybody makes fun of the guy who texts back 3 days later, right? You know, if you shoot me a text, I text you back 3 days later. Everybody makes fun of those people, but I'm one of those people. And I'll tell you why. I don't automatically answer a text message when I'm in the middle of something, because I don't know if you're about to take away my peace. I don't know if
Right.
you're about to hijack my day. And I don't give people that option. If something's important, I concentrate on it because I worked very hard for this levity, you know,
I
and
love that.
to be able to appreciate it. You know, that's like
I need
phone
to get
calls. I don't
better at
answer
that.
them. Huh?
That's one thing that I need to get better at. I spread myself very thin to people. Like I'm
Yeah.
cut, you know, I got the kids and certain obligations that I do or whatever, but I try to make myself always available for people struggling. And sometimes that does take away from what I need to be doing right then and there.
I
It's all
can,
about
yeah.
balance.
Well, you know, and I can tell you this, that it's not only good for you to have those boundaries, but you're also setting an example that they will need to follow when they're out of the hole and they reach back in to pull someone out, that you need to have set an example that they can observe later. Because if you set the example of the infallible leader who's available 24/7 and they try to emulate that and they're unable, that can contribute to relapse, right? So
Right.
it's very important to be the example, to be the change you want to see, as Gandhi said. And sometimes it's not all sunshine and rainbows, right? Sometimes it's not perfect as we wish it could be, you
Right.
know.
It comes with a lot of heartache,
Mhm.
tears,
Yeah.
regrets, resentments. You
Hmm.
have to work on all of those things and still be able to maintain your sobriety with knowing that you used to walk with the devil. Like there's a
Hmm.
lot of things that I did during my addiction that I would never do today
Hmm.
because I like it was like it's like an outer body experience. When I was on benzos, it lowered my inhibitions to the point where I could steal anything and I wouldn't care.
Hmm. Yeah, things that make you cringe later, you know.
Right.
It's
I
I
wouldn't take a
Yeah.
pack of gum today. If I was at the store and I seen a penny on the floor, that penny's sitting right there.
Yeah.
Like I ain't
I
moving.
feel you. It's
Like not at
it's
all.
like that. It's very
Right.
difficult to even process you were there, but also, and this is going to sound, I don't know, trite. I think it's good that a certain amount of us go through that and see that we can be changed so that we can be more understanding of people who are going through it, because they get so just largely written off by society as lesser than, and you know that they're not, because you know that you weren't, you know.
Right. And that's why that's why I'm so vocal to my children about my struggles in the past. They know that I was homeless at one point. When I see a homeless person, I do try to give back.
Hmm.
There are times where like I pulled up in the Dunkin' Donuts line, and here's one example. There was this guy that was laying there in the bench as I was going through the drive-through, and the bench was right by the drive-through window. And I said, you know what? I said to my kids, let's ask him what he wants to eat and what he wants to drink. Like, I want to buy him some food, like something.
Hmm.
And my son's like, Mom, like, you always do this. You're always giving your money to the homeless people. Like, I'm sick of it. And I'm like, you have to have a heart. You have to
Yeah.
empathize with people. I used to be there. That man feels like nobody right this second.
Yep.
Let's put a smile on his face. And you know what? The crazy part is I asked the gentleman what he wanted. He wanted like 16 sugars in the coffee, and I ordered it that way. It
Wow.
was like some crazy amount of sugar. And the people in the drive-through like could tell that it was I guess they knew his order.
Yeah.
So I get the order, and the woman's like, "You did a good thing." Then I pull around and the kids are like, "Can we get out of the car and hand it to him?" And I was sitting right there, like literally. I'm like,
Yeah.
"Yes,
Hmm.
get out of the car, go hand this to this man," because I wanted to teach them humility.
Right.
That is a
Right.
person.
Hmm.
That is
Oh
a
yeah.
human being with feelings. You
Absolutely.
know, when they got out of the car and they handed it to him, they came back to the car crying
Wow.
because they said, "Mom, that looked like Santa Claus."
Oh wow.
The guy had a beard and he
Hmm.
was an older gentleman, and the weight, everything about him just looked like Santa Claus. And my kids were like, Mom, I really think that was Santa. And
Wow.
whatever they want to think,
Yeah.
let them think.
Yeah.
But
Whatever
they
drives it home.
absolutely
Yeah.
right. But that gave them a moment of saying, like, and now they look for that guy when we go to Dunkin' Donuts. Like, like it shows them that that is a human being.
That, we had a similar conversation with Isabella. So she was just asking, she was like, I notice you always tip when we go places to, restaurants. And I had to tell her the story. So when I did 8 years in the Army, and I was a medic. I was a pretty hot shit medic too. I mean, I was good at what I did, and I was known for being good at what I did. I've got my medals and stuff in a shadow box and all the paraphernalia that comes with being young and dumb. And I was very confident in myself when I got out. Well, none of that education transfers over. None of it. So I had to go back to school from day one, like everybody else, when I got out of the service. And here's the fun part. The GI Bill doesn't cover the paramedic program unless it's attached to a degree. So I got out of the service. I had no job. I had no ability to pay for my education. I had this skill that I was good at that I couldn't use. I couldn't even drive an ambulance. So I went to school, and my wife worked as a waitress. And that's how we got by. And she would have days where she would come home just so like busted and disgusted, feet killing her. And, there was like, known wealthy people in the town who would tip 25 cents. And I mean, we're talking about 2010,
Right.
this isn't 1941. And I remember she worked so hard to keep us, this may be emotional. She worked so hard to keep us afloat while I worked on a farm and under the table just to try to make enough money to put the cash up to pay my tuition to this class so I could have a skill. And she just kept cranking it out, man, in the trenches every day. And her boss has a special place in hell for that woman. And I mean, just the abuse she took
Right.
to set us up. And now, fast forward, better than a decade financially, I'm doing well, the talents have been recognized. And now when I go to a restaurant and I see somebody and I see that same look she had on her face, like I know
I
what
know
that
the look.
is. Yeah, and we always make sure we throw, quite a bit of gratuity on there. And when we go out to eat, I almost always make sure I have a few $100s in cash, because I hate the IRS and I know that person doesn't need to pay taxes on that money. And especially like I've seen them when they were pregnant, 9 months pregnant, they're there because they have to be. They're working, they're hurting. I
Right.
know their back is hurting. I know they're suffering. And we always try to brighten that person's day
I do the
by
same because
tipping.
I've worked that service industry. When you work on tips, you know what it's like to survive on tips. You
Mm-hmm.
know what it's like to beat the shit out of your body for that money every day.
Yep.
And you know what? I really commend your wife. That's a true ride or die right there.
Oh
That
yeah.
is
She
that's
she she
true.
did, man. Because we went from, I was making pretty decent money in the service. And I mean, I had an income of essentially zero. I mean, I was making nothing on the farm. And I mean, we were just barely scraping by. We could not have survived on what I was making. And I'm doing clinicals, I'm going to class, I'm buying $200 textbooks, and it's taking me all day to
Why is
make
it like that
$200.
though? Why don't they do that for your particular, like that's crazy to me.
I think they've changed it to include trades now, but at that time it did not include any trade schools whatsoever, which I thought was ridiculous even back then. Now, but
Right. And it is.
so when I went back later to get my degrees, the GI Bill covered uh, some of it. See, that's the other thing about the GI Bill now. It doesn't just pay for your education. It depends on how much time you spent in the combat theater, which they will heavily curate to make sure that they don't have to pay the whole thing. So 90% of my tuition is paid. I felt 10, if I had stayed in Iraq 10 more days, I would have got 100% tuition assistance. But
Wow.
I did 2 tours, so 2 years. And if I had done a little bit, we did the math on it. It's like 10 more days, I would have got 100% tuition assistance. But they would rotate units purposefully to decrease the cost that the VA has to pay later for your tuition assistance and things, which is, it's a pile of hot garbage. But it just kind of goes to show you how the government uses all of us.
And they
And
knew what they were doing. Right. It was
oh yeah,
very
yeah.
calculated that 10 days could make or break your tuition being paid for.
Right, right. And I mean, I guess I shouldn't complain per se. I only had to pay 10% of my tuition, so I shouldn't complain, because it could have been a lot worse. But at the same time,
It was
uh,
stressful.
yeah, it was stressful. That war was also kind of fought under false pretenses. They were snatching up patriotic young kids like me who believed in a cause and sort of leveraging that, and that gets into a whole different thing. I support the troops. Very seldom do I support the people that declare war these days for that reason. But anyway, I don't want to jump off into that tangent, but Miss Carr is definitely one who who kept us alive during that time. And
I love that.
it was all built on that bedrock of that ride or die. And she takes so little for herself in this life. It's amazing. She hates to spend anything on herself. We have a thing, mash the button, because she'll put something in the cart on Amazon and she can't bring herself to spend it on herself. So I actually have to log into Amazon and check to see if there's anything she needed, and I buy it. I have to push the
Right.
button. Hey, Iris, my Aussie's here trying to see us, but I need to feed my toddler. I've enjoyed this, and I could do this
Me too.
again a
I feel
million
like we could
times.
keep going and going and going.
I really think we could, which is, I think, perfect grounds for us to do this again, and hopefully soon.
Absolutely. Whenever you need me, you got me.
All right, pretty please send me all that stuff so I can put all the links and stuff in the description. I'll edit this and try to get it up to date, but I have just thank you so much for being here and for
Thank you.
sharing so deeply. I know it was painful for you, but I know it's going to do good for a lot of people. So
Absolutely. I'm
thank
always happy to help in any way I can.
thank you so much, Miss Marie. You take care, okay?
Bye bye. Thanks
All
for
right.
having me.
Bye-bye.